So you have studied Ayurvedic medicine, and these years take a major part of your life. Once you become a doctor, you are committed to healing. And to be a great healer, learning has to become a never-ending pursuit in your life. So doctor, what are you doing to continue this learning?
A very warm welcome to all the doctors, students and practitioners for this AACHAARA.
Learning experience for everybody, even for me also, isn't it? So there is no end for learning. So that's what actually I believe.
Today's subject you are given is psoriasis.
Clinical dermatology.
If you use Vamana on yourself first, then you will believe that it will help.
Spending few hours with a scholar is equivalent to months of time spent reading books. In the name of AACHAARA, we are bringing excellent minds on Ayurveda with rich expertise in clinical practice. The purpose of this initiative is to guide and uplift the confidence and clinical expertise of every Vaidya. There is a saying, if you cannot be a king, the next best thing is to become a healer, because you are changing people's life, and that is the power of a Vaidya. AACHAARA is a Ayurvedic practitioners only CME program initiated by Sitaram Ayurveda's 100th year celebration through Sitaram Research Foundation. Sitaram started its healing journey in the year of 1921. Being a pioneer in Ayurveda, Sitaram extends the healing powers through a state-of-art GMP certified manufacturing plant, government approved R&D laboratory, super specialty Ayurveda hospital, and an NABH accredited Panchakarma retreat. By attending AACHAARA, you will get the opportunity to get valuable insights on clinical practices, various methods and techniques prevalent in the Ayurvedic medical fraternity from the best scholars. You will be receiving the show notes, certificates, webinar recordings, and the latest updates on your email and WhatsApp. To receive latest updates and newsletters, please send a text to 89434 41881. For more details, log on to our website www.sitaramayurveda.com. AACHAARA, great practitioners invest in learning.
A warm welcome to all to the 181th episode of AACHAARA, conducted by Sitaram Research Foundation and Sitaram Ayurveda Private Limited. Today our topic is on management of pediatric skin lesions through Ayurveda, a bird's eye view. For this session, we have Dr. Arun B, sir, Assistant Professor, Department of Kaumara Vritya, Vaidyaratnam Ayurveda College, Ulur. Today our moderator is Dr. Rahul R. Nair, sir, Professor and Head, Department of Roganidhana, Ashtangam Ayurveda Vidyapitham, Palakkad, Kerala. Welcome, sir. Welcome to AACHAARA. And chair of the session, our respected Dr. D. Ramanathan, sir. Welcome, sir, and welcome all other doctors.
Respected chair of the session, Dr. Ramanathan, sir. Our eminent faculty member today, Dr. Arun B. All the assembled participants who are going to enrich this session with their very wise comments and discussions. The whole Sitaram team who is working behind this AACHAARA webinar series. I respectfully welcome all of you to this episode of AACHAARA. As Ayurvedic practitioners, we used to face a lot of parents coming with the children to our OPDs, especially with the pediatric dermatological illnesses. So many a time we feel that the pediatric population coming to us with the dermatological illnesses needs a special care. Nowadays, not like the good olden days wherein the children were playing a lot outside, eating very natural foods and sleeping at the right time. Instead, we receive the bulk of patients who are especially living in apartments, not exposed to external soil or mud, always in connection with a lot of packaged foods, addicted to their couches with mobile phones. And to such a population, they are coming to us with a lot of illnesses, especially related to the dermatological spectrum. And most of the illnesses have a background of allergies or hypersensitivities happening to them. Many times their parents will be having very mild form of allergies that might be skyrocketing in them because of the changed circumstances in which they live. So we may see that they may be visiting a dermatologist, taking some topical steroids, or internally they will be prescribed with antibiotics continuously, and maybe taking some suppressant medicines like montelukast, etc. But they come to us with the chief complaint that the issue is not going away. Instead, it surfaces anytime there is a change in climate, change in exposure, when the child comes in contact with the pets or animals, or even on a single day when rain happens, when they go outside and just have a play in the mud, they get the same problem again and again. And also we are receiving a huge group of children who are having certain skin manifestation because of the continuous persistent use of medications also. So right in the spectrum, especially those people who are practicing in metro cities, they will be feeling this crowd of population. So to give us a light on this issue of pediatric dermatosis, we are having Dr. Arun B with us. He is an upcoming brilliant Ayurvedic pediatrician who is actually a very warm young brother of mine. We studied together. I am one batch senior to him, and he is an alumnus of VPSV Ayurveda College, Kottakkal, for his graduation. And for post graduation, he was having Kaumarapatyam MD from Government Ayurveda College, Trivandrum. Currently, he is working as an assistant professor of Kaumarapatyam, and I think he's leading the OPD of the Vaidyaratnam Ayurveda College. And wherever he goes, especially previously he was working in my institution, and I could see that he has revolutionized the OPDs of Kaumarapatyam by setting in and bringing in new practices. And also one important speciality that he is having is to connect with the society. That means the children as well as the parents, and to motivate them, educate them to follow a good lifestyle, and thereby preventing the pediatric illnesses. And in this scenario, I think that Dr. Arun B with a wide practice, his clinical practice, his clinical acumen, he's having a lot of good substance to share with us regarding the practice which is to be done in the pediatric dermatosis group. So let's move on to the presentation of Dr. Arun B and I very cordially and indeed very joyfully I am sharing this screen with him. I indeed becoming so happy to be with him in this occasion, to see him speak out from his wisdom. So I very humbly invite Dr. Arun B to give us that share of wisdom. Dr. Arun, please take over this session and enrich us.
So a very good morning to one and all. I must extend my sincere thanks to Sitaram Group, Dr. Ramanathan sir, Dr. Vignesh, Dr. Rahul, Dr. Ramya, Dr. Srijit, and the whole team behind Sitaram, who is organizing such a wonderful series of webinars. And I am here for the second time, privileged and honored to share the online platform of Sitaram Ayurveda Research. My pranams to my guru, Dr. Prakash Mangalasheri. So the topic of today's discussion is Ayurvedic approaches for beginners in pediatric skin lesions. I'm a person who's working with the pediatric patients since last 10.5 years. And I would say that I'm not a dermatologist. I'm not a person who daily see hundreds of skin lesions, but still I'm attempting this webinar in such a way that I would like to communicate the beginners that it is not a much Herculean task to address a pediatric skin lesion if we have a proper understanding regarding some basic medicines and some basic fundamental principles. Just to increase your confidence, I am attempting this webinar. And whatever I am going to present here will be arranged in a sequential manner, starting from some fundamentals, going through the principles of management, modifications that has to be made in pediatric managements, some of my clinical observations. So let us start a session. I have seen many of my students asking me that, Doctor, to study the Kaumara Pratyam, the details of Kaumara Pratyam, is it necessary to know about the Sutrasthanam and Chikilsasthanam? Because from the syllabus point of view, with respect to university or the NCISM, the Kaumara Pratyam, the syllabus point includes the Uttarasthanam 3 portions, including the Balopacharaniyam, Balame Pradeshedam, as well as the Balagraha Pradeshedam. So what I would like to tell them is, without having a fundamental understanding of the Sutrasthanam or some basics from Chikilsasthanam, it is difficult to equip yourself with the mentions in the Uttarasthanam. Because this is the reason why Acharya has given a sequential arrangement of various sthanas in the classics. So having a basic idea of Sutrasthanam is very much essential in moving towards the fundamental principles of Chikilsa, not only with respect to pediatrics, but in any dimension. So we'll see some of the Sutrasthanam principles here. We'll see the pediatric perspectives. I will not be discussing with the Kushta Samprapti, Visarpa Samprapti and all. We'll just see what we can do with respect to a pediatric patient. And I have seen many doctors asking me that, Doctor, is it necessary to have a separate set of medicines to address the pediatric lesions, let that be a skin, respiratory, or whatever it may be? So what I would like to comment is that the knowledge of medicines which we are practicing in a day-to-day OPD with respect to the adult patients may itself be needed for managing the pediatric lesions. So the awareness of minimal medicines, we'll be discussing about that. We should have a working knowledge of to address the initial phase. We should know which is a pathology, which is a physiology, at what point we should refer such cases. So working knowledge will be discussed here. And I feel that many of us forget about the concept of the Ekadosha Vyadhis here. This is one of the thrust area. Actually, we have seen, or we are seeing many of the consultants doing, giving us magical results in addressing the Vada Vyadhis, including the Pakshagadam, Sandhigadavadam, or the regenerative type of conditions. Acharya himself has told that the Vadadika, Sanipadika, or the Vada Pradhana Rogas are comparatively Yapyam or Asadhyam when we compare the same with that of a Kabaja or a Paitika Vyadhi. We know that the skin lesions mainly come into the domain of Kabha or Paitika Rogas, Resarektaspada Rogas, but still we have a fear in addressing such conditions. I feel that it is because of the ignorance about the medicines or ignorance about the cases that comes to us, or due to the less experience, we are having that fear. But if we can overcome that fear, I feel that this is one of our thrust areas to be addressed. And the fast result, let that be Upashayam or Anupashayam, we can very easily see the result. Many a time we may not be having a textual diagnosis to a patient as that of other domains of the clinical presentations. We can look into the dosha avastha, we can look into the guna pradhana avastha of the particular condition, we can modify the treatment. Then some specific kalpana vishesham and its significance in pediatric practices. So we'll be just have a rush through all these areas. So as I told you, first we'll discuss about some fundamentals of addressing the skin lesions. Let us have a basic idea about what is tvak. We know that it is one of the tools for a clinician to understand the roga lakshana, the various varna sparsha bhedas mentioned in the classics is utilized by clinicians to diagnose a particular disease. Along with that, some specific varna swabhavas has been mentioned as the prakrita or vikrita lakshana of doshas too. So tvak can be used as a tool to identify the dosha lakshanas and roga lakshanas. We know that we often interchangeably use the term rasam and tvak. Chakrapani says that tvak shabdena tadashrayo rasa api grihyate. That is, rasa can be mentioned as a representative of tvak. This is the reason why we often interchangeably use the term rasam and tvak. We have studied that dosha dhatu sadamulam. Among the dosha dhatu and mala, we have not seen any mentioning about the tvak. And we know that dosham, dhatu, and malam are the complete, it completely encompasses the whole human life. So when we search again, we can see Tvak is again mentioned as an Upadhatu of Mamsam. Vakbada says that Tvak is formed from the Pachyamana Rektam. I think that many of us have heard about the term Ambu Dharmam. Ambu Dharmam technically means, the term Ambu means we know it is the water, Dharma means the activity. So whatever role that has to be performed by the presence of Ambu inside the body, it is continuously formed, continuously utilized, again replenished. This continuous cyclical involvement of the Ambu inside the body is a role of Rasadhatu. The Sveda Pravrti, we know the integrity of the Tvak is maintained by a healthy Sveda Pravrti, because in the Vridiksha Lakshanas of Svedam, we have studied that Svede Romachudihi, Stabda Romata, Spudanam Tvajaha, the Vriddhi and Kshayam of Svedam may lead to loss of integrity of the Tvak. The concept of Kledam, a debatable topic nowadays. We have studied that Svedam and Mutram are the two important, the Pradhana Malas, which carry the Malarubi Kledam. Kledam is an entity which is present inside the body, and we have studied that Svedasya Kleda Vidridihi, Mutrasya Kleda Vahanam. So we know that the Malarubam of the Kledam is carried by Svedam as well as Mutram. So again, Tvak becomes an important player of Kleda Pravrti. Among the three Roga Margas, Acharya has mentioned Shakha Raktades Tvakcha, Bahiroga Margam. Tvak is a Bahiroga Margam. Among the 8 Saras, we have discussed about the Tvak Sarada, the first Sara. Many times in the records and all, while studying Kaumara Pratyam, when the Sara of the child is asked, we'll be writing about the Tvak Sarada. It is because of the fact that in Tvak Sarada that has been mentioned as Snigdha Slakshna Mrudu Prasanna Sukshma Alpa Gambhira Sugumara Lomasa Prabhevacha Tvak Saranam. When we see the features of a child, this Tvak Sarada can be compared. This may be the reason why many of us write Tvak Sarada in the space, in the column mentioned for the Saram in pediatric case taking. Then, while discussing about the skin lesions, the involved srodhasis should also be given due importance. Among the srodhasis, these are the 4 important ones. Even though we can see involvement of other srodhasis as well, but these 4 names should be given due importance. The Rasavaha srodhas states that the Dushti, cause of Rasavaha srodhushti are Guru Shida, Adisnigdham, Adimatram Samashnatam, Rasavahini Dushyandi, Chindyanancha Adichintanat. The ahara as well as the manasika bhavas of a human being is influenced by Rasavaha srodhushti or vice versa. The type of aharam and the type of viharam. Again, coming to Raktavaha srodhushti, as you know, all these things, I'm just rushing through all these things. Vidahin yannapanani snigdhoshnani dravanicha Raktavahini dushyandi bhajadamcha adaba analau. The Vidahi Swabhavam Aharam is one of the major type of food we are consuming nowadays. The major meal portion is covered by Vidahi Aharas, including the biryanis, the non-vegetarian food items, the stuffed items, the Arabian foods, everything comes under the heading of Vidahi Annapana. And the increased exposure or the awkward exposure towards the sunlight is yet another contributing element in Raktavahastrodho Vikaram. Many a times we say avoiding sunlight is a better option in many skin lesions. Coming to Mamsavahastrodho Dushti, we know that the Moolam of Mamsavahastrodhas is Tvak. Abhishyandini Bhojyani Stulani cha Guruni cha Mamsavahini Dushyandi Bhuktvacha Swapatam Diva. Here also again the type of aharas including Dadi, many Abhishyandi aharas may come into our daily plates, isn't it? Including the Bhuktvacha Swapadam Diva, sleeping after having a heavy meals. The Svedavahastrodhas, we have discussed about the concept of Svedam already. Then coming to Svedavahastrodhas, again the moolam of Svedavahastrodhas is Romakopam. The psychological issues, the manasika bhavas leads to Svedavahastrodho Visheshan, including those that happens due to Krodam, Shogam and Bhayam. Before going to the common references, I think that we have to keep in mind regarding some important elements before discussing the skin lesions. Definitely those include rasam, rectum, lasika, cledam and svedam. This has to be kept in mind. And interestingly, we can see that this reflects the Kabha Pitta doshas too. So in addressing a skin lesion, the importance should be given to all three doshas with special reference to Pittam and Kapha. Okay. Now, the common references which has to be kept in mind before addressing a skin lesions includes, of course, we know Kushtam, Visarpam, Krimi, Karappan and all. Out of this, I would like to say that in addressing pediatric skin lesions, we can take all these things as some referral models. Rather than sticking on to some basic principles alone of the Kushtam or Visarpam, we can consider these things as models through which we can alter the applications of medication in the pediatric practice. Out of them, the last one which I have mentioned is Karappan. Karappan is the technical Malayalam term that was used by the legendary traditional Balachikilsakas in Kerala. The reference of Karappan can be seen in the traditional Malayalam pediatric textbook of Arogya Raksha Kalpadrumam. Karappan means the Bala Visarpam. Any sort of skin lesions which is having a spreading nature, which not only because of its contagious or the upasargika swabhavam, but because of the Vyadhi swabhavam, the condition is known as Karappan. And Arogya Kalpadrum mentions about 51 types of Karappan based upon its morphology. I was fortunate to meet the legendary Balachikilsaka, Sri Gangadharan, whether I was working under him, as told by Dr. Rahul. We were working in Ashtanga Ayurveda College, and he is one of the living legendary Balachikilsakas who gives us an idea about the Karappan and all. And he told me that among these 51 types, in his lifetime, he had not seen more than 16. So that is about Karappan. Then, apart from the normal prakaranas where we look for addressing a skin lesion, we have to have an idea regarding the Shobham, Vadarektam, especially the Uttana Vadarektam, Jwaram, Pandu, of course, the Kshudra Rogas, which includes the Ajagaliga and all, Pachana Gardabam, Mukhadushika and all, Prameham, Shitapittam, Udardam and Kodham, Vidradi, the special type of Avarana Vatas, Shvitra, including the Sneha Vyapat. We often miss the concept of Sneha Vyapat, but we have to think about Sneha Vyapat. It is an area where Takra Ishtam and all are mentioned as medicines for addressing Sneha Vyapat. Now, coming to the basic principles in Bala Chikilsa. This is universal in Bala Chikilsa. This is not for exclusive skin lesion, but this is universal in all type of pediatric patients. As we know, we have some Rogi Parikshas, including Darshana, Sparshana, Prashnehi, Pariksheda Rogina, isn't it? Among these Rogi Parikshas, it is not an easy nut to crack, isn't it? Because many a time will not be possible to have a Prashna Pariksha in a Kshira Annada or a Kshirada. Sometimes the Darshana Pariksha itself may not be possible in case of a Kshira Annada. So even in such challenging situations, Acharya is giving some leads to modify our approaches in pediatric identification of diseases. Vagbhada has told that to identify the child having a disease means he'll be crying. Rodanad lakshayed rujam. If he could satisfy the appetite of the child by sufficient food or milk or whatever it may be, till the child cries, that means the child is having some disease. Then, of course, if possible, we should try with the respective Rogi Parikshas, including Darshanam, Sparsham, and Prashnam. Along with that, we have to think about the Rogi Pariksha method, which is a non-invasive thing which can be done from a Rogi and Kshira Annada. It is nothing but the Stanya Pariksha. Vagbhada again says that if you are not clear with the reference of Rodana Lakshaya Drujam, this is yet another area. This is yet another reference. You can go through that. That is Swayam Sprished Brisham Yatraja Sparshana Akshamaha Tatra Vidyadrujam. He says that if you are not getting a clue regarding the area of the disease or the area of the pain, area of the discomfort, you can just observe the child. And if the child continuously touches or moves his hand in an area, and the child will not be allowing the examiner to touch that particular area, then around 80% of the chance to have a disease in that area is for sure. Charaka Samhita says that Balo mridu bheshaja sevaniyanaha. While selecting medicines, we have to keep this in mind. That is, the high potent medicines cannot be administered in a child. Again, Vagbada says that Rogamsha asya jayehi saumyehi bheshajehi avishadakaihi. The bheshajam should be saumyam. It should be less potent. And it should be avishadaga too. The saumyata is not just based upon the quantity of medicine. We have to keep that in mind. It depends upon the quality of medicine as well. Because we always feel that while giving kashayam and all, the reduced quantity itself may accommodate this principle, isn't it? But again, we have to think about the nature of that particular medicine. For example, we cannot give the medicine of Gugulutang kashayam or Varanadi kashayam with the same principle as that of Guluchadi or Drakshadi kashayam. Even though all four of them are kashayam, the potency differs with respect to the contents inside those medicines, isn't it? So Saumyada not only depends upon the quantity, but also upon the quality of the ingredients. Avishadakaihi means, Vishada means that causes Vishadam, isn't it? So Avishadaka means it should be, what I say, I will put it in such a way that it should be more palatable to the patient. But the thing, palatability is often not compared with the quality of the adjuvants which we add to improve the palatability, isn't it? Many a times we used to see parents giving jaggery, parents giving sugar, parents giving honey without thinking about the condition of the child. In constipation, if we give jaggery as an adjuvant means the quality of jaggery will itself improve the condition of the patient. But what happens in constipation if honey is given? The constipation may increase. Here, both honey and jaggery are considered to reduce the Vishada Sabhavam of the medicine, but still we have to think about the property of the respective adjuvants or the Sahadravyam or the Prakshepa Dravyam before adding to increase the palatability. The previous verse which I have mentioned, Swayam Sprished Brisham, the first picture you can see the child is touching his abdomen. When the child continuously touches his abdomen, and if we try to examine the patient, the child will not allow us to touch the abdomen, means that may be a case of a tummy upset or an evening colic or an abdominal colic. Now coming to the second, this is a video. See, the child is continuously touching his face. This is a 3-month-old child, continuously touching the child's face, ears, forehead, and neck. This was a video that was shot by the parent when the child was cranky. And from the clinical domain, interestingly, this child was having atopic dermatitis. The irritation, the itchy nature of the skin, which was not presented or which was not traced out by Darshana Pariksha of a clinician, could be traced out from the Prashna Pariksha from the parent or by just observing the fundamentals of the principles in identifying the lesions in pediatric practice. Now, I told you about the third type of pariksha in Kshira-ada or Kshira-annada when compared to the Annada. That is the Stanya Pariksha. Stanya Pariksha, of course, is the easiest method, and it is a non-invasive method, non-expensive method, and the most convincing method that you can perform in the OPD itself, just in front of the parent. You just need 1 tumbler of water, take few drops of stanyam and slowly instill the milk into this fresh water. We have studied that if it is of good stanyam, it should form a uniform mixture with the water container, isn't it? But if it is having some impurity, means what happens? This uniform mixture is not formed. Instead, the changes that is happening in mixing will give us an idea regarding the doshic predominance that is happening in stanyam, which may be the only source of doshic visheshan in a child. That is, in the case of the Kshirada, the child is not taken to outside, the child is staying with the mom, and the only source of aharam is stanyam, means That is the only source of doshic vitiation that may lead to, or that may end up in particular clinical conditions, isn't it? See, after instilling the stanyam, it is not mixing equally. Instead, it is getting settled at the bottom after forming some thread-like presentations. On the superficial area, we can see some froth-like presentations. The Guru Sabham of stanyam made it settle down at the bottom. The Tandumat Sabham of the stanyam is making it as a thread-like appearance. The same time, the Bhena Sabham of the stanyam can be noticed over the superficial layer. So this was concluded as the Vada Kava Pradhana stanyam. And when we compare this with the clinical conditions, the doshic assessment is made easy. Even in case of investigations as that of USG, MRI and all, we can see a comment that is written by the radiologist at the bottom of the impression. Correlate clinically, isn't it? So the correlation can be done later, but the assessment of doshas is made easy with the help of these type of examinations. Hope the video was clear. Then we have seen the principle of managing any type of skin lesions, any type of lesions in the previous slide. Now coming specifically to skin lesions, we'll see what is the principle in managing skin lesions in children. In addressing skin lesions, the basic principle in addressing skin lesions, as we know, Bahudoshasya lingani tasmehi samshodhanam hidam, isn't it? Shodhanam is the best option in addressing any type of skin lesion. But Acharya at the end of this verse has told that this should be done yadha balam, based upon the balam of the respective patient. The general nirukti of bala itself is an interesting thing. Bala has been told as balena nyuna iti balaha. Bala is a person or is a living being where the bala is less when compared to an adult human being. So technically, in a person whose bala is less, we cannot perform samshodhanam. This is one of the reasons why we generally contraindicate tikshna shodhanas or panchakarmas in children. So again, we have to keep this in mind that technically shodhanam is not possible in a child, but modifications of shodhanam, if needed, or if the vyadhi is atega in nature, we can perform based upon the risk-benefit ratio. The principle of selecting medicine, Vagbada is telling that dosha dushya jvara adhya vyadhayascha tad atastadeva bhaishajyam matratu asya kaniyasi. Vagbada says that the dosha swabhavam, the dhadu swabhavam, the respective vyadhi swabhavam, everything remains the same as that of an adult in the case of a pediatric patient. Then there is no need for going for some other medicines, but instead you can select the medicines from the respective pragaranas of that mentioned in Chikitsa Sthanam itself. But the only thing is that matra tu asya kaniyasi. The dose should be less. Kaniyasi, here the term signifies the same meaning which was discussed in the previous slide. That is the saumyam. Kaniyasi means not exclusive. The term is not exclusively used for the quantity, but again for the quality. Because we know that in many cases, for example, in the case of Kshira, in the case of very newborn child, even though the dosham, dusham, vyadhi, everything we are comparing with that of the adult, but we can't give medicines which is having more potency. For example, we won't give arishtas because arishtam is a madhyakalpana vishesham. Madhyakalpana is having the opposite property of that of ojas, or madhyakalpana is having the same property as that of visham. So technically, madhyakalpana is not an advisable choice in any type of pediatric patients, especially in the kshirada or kshirannada. And if it is that much needed, you can modify the administration of medicine either by looking into the potency of arishtas or by mixing it with sufficient quantity of water accordingly. So the term kaniyasi doesn't always mean about the quantity of medicine, but also the quality should be checked. The same thing happens with respect to rasa aushadas too. Vagbada says that anyatra atikadi vyadhe viregam sutaram tejer. The most contraindicated panchakarma in a child, you'll be getting such questions for entrance examinations and all, isn't it? The answer is virejam. It's not vamana. Because when we look into the commentaries and all, we can see the balam of the child. We know balam, as I told you, balam is less. This decreased velam can be compared with the reference which we get from Rajekshma and all. There the malam itself is the velam. So if we try to give a strong purgation means we are trying to reduce the normal velam of the child, which may end up in grave situations. So Virejanam preferably is not advised in any type of lesions in pediatric practice. If it is that much necessary, as I told you, we have to think about the risk-benefit ratio, then we can advise the Virejanam. And instead, we can try for some vastis. But interestingly, in addressing skin lesions, as we know, Pittam being an important dosham, playing a crucial role in skin lesions, Virejanam is one of the best method of choice in reducing the lesion, isn't it? But unfortunately, being a pediatric patient, yet we have to face some challenges in advising these type of Virejana procedures. Then, coming to the first phase of addressing, as of any other lesions, here also we'll be having an Amavastha, where the intention of the clinician is to perform the Pajanam. We have n number of options to perform Pajanam, n number of options. General options which we take is we go for Lankhanam, we go for the Ushna Virya Swabhavam and all for doing Pajanam, isn't it? But the most important thing which we have to keep in mind in addressing or in performing the Pajanam in a skin lesion is that never try to do Pajanam with the help of Ushna Virya Aushadas or the Lankhana Swabhava Prayogas if you don't have a clear idea regarding the presence of an Avaranam in the Tok Roga. The best option that you can depend is Rasa Pajanam. We have studied that Rasam, Gunam, Dravyam. Among them, each of them is designed to perform some functions, isn't it? The function that is done by the Rasam will be different from the function that is done by the Gunam. It will be different from the function done by the Viryam. Here, interestingly, the Rasa Pajanam is the best method that was told by Acharyas in addressing the skin lesions. Among the rasas, among the Shad rasas, Tikta rasam is the best rasam, which is having both Pajanam and Vibhana property, and the Tikta rasa does Pajanam with the help of Laghu Sukshma Gunas. And this Laghu Sukshmata of the Tikta rasam will lead to the Pajanam of the Amavastha with respect to Rasarakta or the Kabha Pitta Dosham, which is the most common picture which we can see in a skin lesion. When we see the reference of Tiktarasam and all in the Rasabhediyam Adhyayam, it has been told that Tiktam, even though it is Swayam Arojishnu, it overcomes Aruji, Krimi, Trit as well as Visham. And Tiktarasam can be even used for Stanya Shodhanam. So Tiktarasam is the best choice that can be utilized for performing Pajanam in any type of skin lesions. When we just go back to the reference of Kushtam, Visarpam and all, we can see the benchmarking of Tiktarasam in those contexts. We can see Tiktagankashayam, we can see Mahatiktagankashayam, we can see Vajraga Prayoga, everything. Most of the, around 99% of the formulations will be having a predominance of Tiktarasam. This has to be kept in mind because as I told you, Tiktarasam is important in performing Pajanam in a skin lesion means the rasa is having a significant role in addressing skin lesions. We often forget this and we may run behind the Avishadagata Swabhava alone, or we often think about the palatability of the drug alone. Sometimes this may be one of the reasons why we are not getting proper result in skin lesions. If a drug has to perform with rasa means that rasam is aswadyamanaha as rasa. That rasa should be made available to the child. If that is not available, made available to the child means that drug, the quality of drug is bypassed or modified. So that is no longer, for the time that is no longer the same drug. If you give Tiktagan Kashayam with Jaggery means that is not Tiktagan Kashayam which has been told to address a skin lesion. So such modifications, even though we face challenges in addressing skin lesions without having some modifications, but still this principle should not be forgotten. What we generally do is in case of skin lesions, if we don't have an option, we'll be preparing the arkas. And I myself felt that in case of palatable issues and all, if the child is unable to take kashayam, that is the last option. I don't give arkam and all as the first option. That is the last option. Initially, I'll be looking for exclusively prepared kashayam. If not possible, I'll be looking for the kashayam tablets. Then I'll be looking onto the arkas. And I will always ask the parent that, see, this is the best choice. The choices of yours, because there are many children who comes to OPD, including our personal experience, who are fond of having tiktarasam. Always the parents are prejudiced that the child be very fond of having madhuram only. But nowadays, we don't get such patients who is very fond of having madhuram and all. Nowadays, children are very fond of having katu, amlam, lamanam and all. So such type of modifications should be made intelligently. And when we see prescriptions from patients, we can see that in skin lesions, the writing of medicine is made in such a way that one kashayam will be there, one gulika, sometimes some churnam will be there. And of course, all those prescriptions will be containing some external applications or some tailas or lepas in the first prescription itself. Generally, such type of lakshanika chikilsas or such type of medical administrations is not recommended, because Acharya himself has told that in the Kushtam, he has told that dosha bhediya vihidehi adishailinga karma bihi kushteshu doshol banadam. That is, understanding the Tvak vigaram, the presentation of Tvak vigaram will not be sufficient to address any type of skin lesions. Instead, we have to think about the underlying doshic features that was told in the fundamentals, that was told in the Sutrasthanam, including those of dosha vediyam or the dosha pakramaniam and all. Then we have to reach a final conclusion to address the case. Instead, never try to go for a lakshanika chikilsa in your first prescription itself. Sometimes that may aggravate the condition. Then when we should do the external lepanam or the specific methods to address the external issues. Vagbhata has told that doshe vijide andaha tvakste, that is, the lepanam or the external applications are generally advised only when the clinician is sure about the abhyantara shuddhi. In Vaidya Tarakam, again, an important traditional regional Malayalam textbook of pediatric practice, apart from the Arugya Kalpadruvam, the author has told that Ulkarappan Shamikyade Purame Enna Unnume Tepikyade Irunnidan Pratyegam Shraddha Vekkanam. The same principle that is told in Vashtanga Hridayam, that is, without addressing the Shuddhi of the Abhyantara Shuddhi, never apply any oils or any external applications. Then coming to our options of external applications, we have lepas, we have oils, we have gridams, including Shatadhauda gridam, Jatyadi gridam, the Tiktaka gridam, and many guligas are there, including Karattavattu, Mukkadi Purambada, that can be made into a powder, and the respective adjuvants can be used to make into a fine paste, and external applications can be made. Karattavattu and all are more Shita in nature. It can be used to address pitakas. Mukkadi Purambada, even though mentioned as one among the Aushadas in Shalaki Tantra Chikilsa, again, it can be used in skin lesions at all, because it has been told that Vikam Chudum Rujayumudane Handyada Pyanjunalil. Coming to special Vishahara lepas. Lepas, the term doesn't always implies about the ointments. There are other references too. The most common Vishahara external applications includes the Neeli Daladi Keram. It is a modification of Neeli Tulasiyadi Kashayam, which is available in the market. Vilwadi Guliga again, Shikru Punarnavadi Lepam and all. Then an important thing that we have to keep in mind is we always know, we know about the usage of Gandhagam, and we often write Gandhaka containing oils or prescriptions containing Gandhagam, isn't it? The important thing that have to be kept in mind is that the free elemental Gandhagam may react with the moisture, it may react with the sunlight, and it may lead to some acidic formation. Sometimes you'll be getting patients, and after writing the medicines like that of Gandhaka Thailam and all as external application, patient will be coming and telling you that, doctor, my skin lesion got aggravated. So you just ask them the time of application of medicine. They'll be telling that they might have applied in the morning after bath, and they might have went outside, they had a sweat, they may be exposed to sunlight and all. This may lead to an increase in presentation because of this chemical reaction, because the free elemental gandhakam, if by any chance present in these type of medicines, means that may lead to some sort of reaction ending up in sulfurous acid formation, which may aggravate the condition. So whenever you write medicines which contain gandhakam, especially in oils, advise them to use it only during night time, and never wash those applications. We have to clean it with a white cloth or a dry cloth, then washing is advised to overcome this complication. This is a very simple clinical tip that has to be kept in mind. And don't forget that gandhakam is having keratolytic property too. So in lesions where you feel that some sort of keratolysis is required, like that of in lichen planus and all, you can select aushadas like that of gandhadailam and all. Sorry, gandhakadailam. So it's not gandhadailam, it is gandhakadailam. Now, the common medicines which we use in addressing pediatric skin lesions includes Guluchiyadi Kashayam, it is more of Pitta Kapha Shamana in nature. Drakshadi Kashayam, more of Vada Pitta Shamanam, Rasayanam and Ojasyam in nature. Aragvadadi Kashayam, a good choice where the Kapha predominance can be seen. Pajanamradam Kashayam, which is more of Tiktarasam in nature. And I would like to mention one more thing before going to medicines. Generally, the drug of choice for the skin lesion, we have seen that the Tiktarasam is a good drug of choice. And while if the drug of choice for skin lesion is Kashayam, I feel that the Kashaya Churnas are the best choices. And generally, I used to prepare Kashayam with Sukshma Churnam as well as the coarse powder. The general method of preparing Kashayam that was adopted practically and that was found to be effective is in such a way that I'll be taking, if it is Sukshma Churnam, I'll be taking half teaspoon of Churnam. I'll be advising the patient to boil 1.5 glass of water. Just I will ask them to boil for 5 or 10 minutes. That is enough. And from that, the required doses will be advised. If it is of coarse powder, 1 teaspoon powder with 2 glasses of water, I'll ask them to reduce to 1 glass. And from the respective available prepared medicine, we'll be fixing the dose accordingly. So that is a general method, because I genuinely feel that the preservatives inside the medicine may aggravate the condition if it is of a skin nature. If you don't have other choices, definitely you can try the bottled kashayams. But the first choice, I prefer powdered kashayams in addressing skin lesions. And also in the GIT issues as that of amlapitam and all, I generally don't advise bottled kashayam. Instead, I will be going for the churna kashayams. Because I genuinely feel that some sort of modifications in the market, in the preservatives, because many a times Guluchayadi Kashayam, we feel that Guluchayadi Kashayam is a good choice for amlapitam. But patients will come and tell that after taking Guluchayadi Kashayam, amlapitam has been aggravated. So even though the diagnosis may be correct, the drug of choice may be correct, the formulation's peculiarity might have led to the anupashayatvam in the patient. So Guluchayadi, Drakshadi, Aragvadadi, Pajanamradam. We should take care in advising Pajanamradam Kashayam. Pajanamradam Kashayam is Tiktarasam in nature, and many a times continuous intake of Pajanamradam Kashayam has been connected with the change in the glucose level in kids. As I told you, they are Sukumara, they are Aklesha Saha, they are running on their para-ojas. Their ojas is not completely formed and all. So the hypoglycemia, which may be caused due to the intake of kashayams like that of Pajanamradam, may end up in complications in children. So we have to keep an eye while giving medicines like that of Pajanamradam Kashayam. Again, coming to Amrita Rajanyadi Kashayam, more of Pitta Kapha Shamana in nature. We generally advise such type of medicines in Udaradam, Shitapittam and all. Neeli Tulasiyadi Kashayam, one of the magical drug which we can see, one of the magical drug. Neeli Tulasiyadi Kashayam is a Keraliya Chikilsa prayogam. The Neeli Tulasiyadi Kashayam is more of Pitta Kapha Shamana in nature without aggravating the Vada. So it is one of the best drug of choice in any type of Visha. I remember late Dr. Mahadevan sir, he used to tell that if you are not sure about the respective medicine or respective diagnosis, Kalyana Kashayam is a good choice. He used to explain this in a jovial manner. Here I would like to say, if you are not sure about the respective Vesha Swabhavam or respective Dosha Swabhavam, Neelatulasiyadi is not found to cause any anupashaya. That is my observation because it is more of pitta kapashamanam without causing vada aggravation. So Neelatulasiyadi Kashayam again is a good choice. I told you Neelatulasiyadi Kashayam is available in the market as oil as well. It is known as Neeli Daladi Keram. Makki Puvadi Kashayam is a traditional Malayalam combination. I have not mentioned much Malayalam combination which is not available in the market. But here I should not forget to mention Makki Puvadi Kashayam because it is one of the best drugs which we get in Kerala to address the Agakkarappan condition. We'll see what is Agakkarappan. It is one of the best choice to address the Agakkarappan condition. Coming to the common gulikas mentioned in skin lesions, Gopi Chandanadi Gulika. Gopi Chandanadi, actually it is a Kashaya Yogam. That Gopi Chandanadi is a modified Kashaya Yogam which is known as Karika Kashayam because we make Gopi Chandanadi Kashayam with tender coconut and in the market it is available as the Gopi Chandanadi Gulika. It is more Pitta Kapashamanam and Bala Visarpahara in nature. Ariyaradi Kashayam or the Shattanduladi Kashayam. It is again Pitta Kapashamanam as well as Krimiharam and Visarpahara in nature. Pilvadi Gulika. Avipatti Churnam, Rajanyadi Churnam. We know about Avipatti Churnam, isn't it? Avipatti Churnam can be used as a Virejana Aushdam as well as an Anulomana Aushdha too. Generally, as I told you, Virejanam is not that much indicated or Virejanam may cause grave issues in child means we can go for Anulomanam, just modify its application. I usually reduce the dosage of Avipatti Churnam, give it at night after bedtime. It doesn't cause much issues while just modifying the Avipatti Churnam in that manner. Rajanyadi Churnam. We are very fond of Rajanyadi Churnam and Gopi Chandanadi Guliga when a pediatric patient comes to us, isn't it? And if you are a general practitioner or if you are specialized in some other branches, means the first two drugs that comes to our mind when a child comes to our OPD is, of course, Gopi Chandanadi Guliga as well as Rajanyadi Churnam. But I genuinely feel that Rajanyadi Churnam is not a very good drug of choice in the first visit of a patient if he is having an Amavastha. Because Rajanyadi Churnam is basically a Deepan Aushadam, a Rasayana Aushadam. It is not having that much potency to do the Pajanam of the lesions because we know the reference of Rajanyadi Churnam is Dandolpatti. The Dandolpatti means it is a normal physiology, isn't it? So we cannot expect a high potent drug to be given in the context of Dandolpatti as a Pajana Aushadam. So I feel that if your drug of choice is Rajanyadi in skin lesion means postpone the Rajanyadi prescription to the final stage. That is, you can give Rajanyadi as a Rasayana Aushadam or a medicine where we expect not to have the Apunarabhavato. The gridams, the common gridams which is available in the market and which we can try are Tiktaka gridam as well as the Aragvada Mahatikta gridam. Both of them are available in the form of soft gel capsule as well. So that again becomes the modification to fulfill the criteria of Avishadagaratam of medicines in pediatric practice. Eladi, Nalpamaradi. Eladi is more of Vada Kabahara in nature. Nalpamaradi is more of Pitta Kabashamana in nature. Nilidaladi Keram, I told you, it is a modification of Nilidalasi. It is Pajana, a Padana Sneham is Nilidaladi Keram. Bhujagalatadi is one of the best choice, which is not that much Ushnam or that much Shidam. It contains the Panchagandha, it contains the bitter leaf juice. It is a good drug of choice, especially in case of Darunakam. External applications of modifications other than Thailam includes Shadadauda Kridam and Jatyadi Kridam. The Rasayana Prayogam, the common Rasayana Prayogas with the minimal medicine intervention can be made out with the help of Guluji Sattvam. Guluji Sattvam is available in the market as Giloy Sattvam. Dabur is preparing Giloy Sattvam. And Samshamani Vadi is a good drug of choice with Guluji content, the Sattvam of Guluji. Rajanyadi, as I mentioned previously, it is more of Rasayana in nature. And in the market, you will be getting n number of patent drugs in addressing skin lesions, especially the external application drugs. N number, you have large number, you'll be getting Metascab, Trichoderm, Exitox, Nini. So many drugs are available in the market made by the reputed manufacturing companies. So this is in a nutshell regarding the common medicines which we advise in skin lesions. Then, along with the medicine, what is the need of Pathyam? Parents or patients always think that Pathyam is the set of instruction that is to be followed when somebody takes Ayurvedic medicines, especially Kashayam. This thought has to be corrected. We have to convince the patient that We are not magicians, but we are just barefoot clinicians. The communication of the significance of pathyam and convincing the patient about the need of pathyam will help us a great in modifying the diseased condition in the respective patient sitting in front of you. For that, we have to understand the some basic principles of advising pathyam. Unless and until we are convinced means we'll not be able to preach the same, isn't it? So the need of pathyam can be highlighted by the following steps. Significance of Rakta Shuddhi. We know that Rasa Rakta Ashrita Vyadhis or Rasa Rakta Dushti Vasrodo Vigara leads to the respective conditions means the significance of Rakta Shuddhi is much essential in addressing a skin lesion through the pathyam. We know that the twak is formed, as I told you, the Pachimana Raktam leads to the formation of twak. That is, twak is formed like that of the covering of the kshiram. Once the kshiram is boiled, the same thing happens. The formation of rectum, at the formation of rectum, the twak is formed. So the quality of rectum will reflect on the quality of the twak. So Rakta Shuddhi is essential. Nidanam of Kushtam we know, Mityahara Viharena. That is the Mithya Swabhavam or the improper intake of aharas will lead to Kushtam. So the proper intake of aharam is much essential to overcome the possibility of having any type of skin lesions. We discussed about Rasa Rakta Vasrodushti, and there is a reference that Rakta Prasadad Twak Prasadam. Twak Prasadam happens with the help of Rakta Prasadam. In Amarakosham, there is a synonym for Twak. It has been told as Asrigdhara. That is that which holds the rectum. So Rakta Shuddhi is required for the Twak Shuddhi. We know that rectum is a Madraja Bhavam that is formed during pregnancy. So, proper Garbhini Paricharya may help in equipping the fetus with the quality rectum, which may end up in quality skin. The Asrayi Bhava of Pittam and Raktam should be kept in mind, and Pitta Prakopi Ahara should be avoided for attaining proper Rakta Shuddhi. Not only the ahara, but also some type of viharas as like that of Vegadharanam, especially the Vegadharanam like that of Chardi. If a patient comes to us with vomiting, if the child is okay with the respective expelling of the Vishaswabhava ahara or the Vishaswabhava content, I think that the Stambanam should not be done in such cases. Of course, we have to check about the health issue. But if all of a sudden we do the Chardi Dharana means that may end up in lesions as that of Kushtam, Visarapam on Cordam. Technically, it may end up in some sort of urticarias too. In the Sandarpanota Vigaras, we have references like that of Prameham, Pidaga, Kodham, Kandu, including Kushtam. So Sandarpana can lead to such type of lesions, which may include a wide variety of skin lesions. In the reference of Viruddha Aharam, it has been told that Kushtam, Kilasam, Visarpam and Vispodam can happen if you take Viruddha Aharam. So again, the need of Pathyam is highlighted there. Along with all these classical references, the Western prescriptions are modified in such a way that they are now focusing on green prescriptions. The term green prescriptions is gaining popularity in the West, which includes a note on how to stay physically active and how to eat healthy. That is, the modifications of any systems of medicines can be seen either due to the ineffectiveness of the respective method or due to the more effectiveness of these type of applications. So I feel that even the modern medicine people are focusing on such type of prescriptions along with their respective medicines. And it is very clear from our clinical observations that if Pathyam is not followed, definitely the modification of disease will not happen at any cost. So by keeping all these things in mind, we have to prepare a list of Pathyam, or we have to point out the Apathyas taken by the child. The most common Apathyas in children, which we see day to day in a clinical practice, includes the Masha Samskrita Aharas. The all Masha Samskrita Aharas, which we Madrasis mainly eat, include idli, dosha and all. The Masha Sabhavam of the Guna Sabhavam of Masham includes it is Ushnam, Snigdham, and of course, we know that the Purishjanya Krimi, which is having the same Nidhanam as that of Shleshmajanya Krimi, the two differences are Masham and Shaga Vargam. So it may end up in Krimi also. So when we advise Pathyam, just look into the patient, modify these type of applications, just ask the patient to take away Masham, just let them make a rice paste only. They can make dosha and idli with the just exclusive rice without adding the Masham. Vidahini Annapanani, I told you in the first slide itself, bakery, sweets, and bottled drugs, again, a big culprit or the most common apathyam taken by the children. Non-vegetarian food and egg, again, Ushna Sabhava Aharam, Vidahi Aharam. Papad, potatoes, even Acharya himself has told potatoes as the most Nindya Kandam. But still, this is one of the most commonly served dish as fried potatoes, French fries, and all, isn't it? So avoiding potato is an important step to be taken in addressing skin lesions. In Kerala, we get a free supply from government. It is known as Amridam powder. I have seen many patients with aggravated skin lesions just by the intake of Amridam powder. It is a weaning powder. It is given throughout the Anganwadis or the primary health centers and all. I feel that it is because of the improper combination, because we know that most of the skin lesions are Rasarekta Pradoshajam. In the Amridam powder, there are so many nuts, there are so many millets and all, and many of them are having different. We cannot expect the same Agni Balam to digest various nuts having different Guna Swabhava. If they are made into a powder, means that may end up in the Koshtam, leading to Amavastha. This may be reflected in the Rasarekta. So I feel that avoiding Amridam powder, at least during the period of addressing the skin lesions, is much essential. Amridam powder is just a term which we can take in the northern parts of India. If such type of measures are available, preferably avoid them during your addressing a skin lesion. Of course, we are very much aware about the pickles, katu, amlam and all, isn't it? We often forget the sour fruits. Don't forget to tell about the sour fruits. It includes the pear, this orange, musambis, grapes and all. So we feel, don't just think about the calorific value, nutritive value. Instead, beyond that, the calorific value and nutritive value becomes significant only if the patient is an arogi. That is, all those things can be discussed in case of a swastha. If your Agni Balam is not that much potent to address these type of different applications, means you may end up again in aggravating conditions or end up in Anubhashaya. Don't forget to ask them to avoid Lashunam, vinegar, Kulatham. We often forget about Padyushidam Jalam and Aharam, isn't it? We may think about Aharam. We advise generally patients to not to take refrigerated food items which was prepared on the previous day. We advise them to avoid such type of Aharam. But we often forget to tell them about the Paryushadam Jala. Vagbada has told that the water that was boiled and kept overnight will be ending up in Tridosha Vriddhi. That is, Paryushadam Jalam is Tridosha Krit. Just imagine our kids who are taking this Paryushadam Jalam since their LKG classes or since their play school classes, continuously, daily using the water boiled on previous day, because usually mothers will find an excuse in telling that in the morning it will be busy. So what I do is I'll be boiling the water on the previous night itself. I'll be keeping it. The next day it will be easy for me to serve because it becomes cool and it is easy for me to serve into the bottles. What she is doing? She is giving bottled Tridosha Vriddhi to each and every child, not only for one day, but for the initial 12 or 11 years where the Dhadu Pushti is expected to have achieved. See? So this may be one of the contributing factor why we are seeing much a number of lifestyle disorders nowadays, isn't it? We have to think on that. It is our basic principle. So ask them to avoid Paryushadam Jalam, not as a pathyam exclusive with respect to skin lesions, but as a general Swastha Vrittacharya, advise them to avoid Paryushadam Jalam. I think that most of us might have heard about the leaky gut, isn't it? Leaky gut. It is a hot debatable topic again in the modern medical field. Once your gut becomes inflamed, means chance of an abnormality with respect to your behavioral issues or brain functions can happen. This is known as leaky gut. when we discuss about the autism spectrum disorder and all, modern medical science put for this as a hypothesis as a cause of autism spectrum disorder. This is why we don't advise gluten, we don't advise casein, we give a separate diet pattern in addressing the autism spectrum disorder, because once the leaky gut is addressed means the behavior of the child improves. Among the aharas, I think that we have covered almost the most common things, but we often forget about the soap. Parents always believe that usage of soap, if you see an Ayurveda doctor, usage of an Ayurvedic soap is always recommended in any type of skin lesions. But I would like to say that unfortunately, no Ayurvedic soaps is good in a pediatric skin lesion addressing, because many of the soaps that is available in the market from the Ayurvedic labels, it is more form forming. The skin of a child is very delicate, we know, isn't it? It is very soft, very delicate. As I told you, the child is more of tvaksara in nature because of the Vaya Prakriti. So if we try to give a soap which creates more form, means that itself may hamper the normal healthy situation of the skin. So advise them to go for a soap which is having more glycerin content. It is available in the market, more glycerin content, or just advise them to go to a medical store and buy a neutral soap which is not producing much foam. So these are the common apathyas which we see in our day-to-day practice. We have to keep in mind. We'll be seeing patients coming to us with skin lesions, respiratory skin. Once the integumentary comes down, the respiratory arises. The respiratory goes means the integumentary starts. An important idea of the common embryonic origin regarding the integumentary as well as the respiratory should be kept in mind. The lungs and the skin are having a common embryonic origin. Both of them are found from ectodermal in origin. So we have to keep an eye on this. Even though we don't see similar lesions in all children, but nowadays we are seeing such lesions in many children. I hope that all of us might have heard about the term atopy, isn't it? The skin respiratory combination is the most common presentation which we see in atopic dermatitis. The three common dermatitis includes atopic dermatitis, contact dermatitis, as well as the seborrheic dermatitis. Out of this, in children, one of the challenging area, one of the most difficult skin lesion to be treated is atopic dermatitis. See, in such cases, sometimes snigdha application will be seen upasham. But the same snigdha application will be seen as anupasham after 2 days or after 1 week. This again reverses. This unpredictability of application of respective viryas or gunas itself makes this condition a yapya or asadhya roga. This has to be kept in mind. So never plan a complete protocol in addressing atopic dermatitis if it is full-fledged, because it continuously changes its pattern. This is the reason why we cannot predict the fate of atopic dermatitis. We often use the terms atopy and allergy interchangeably, isn't it? Just one example. For example, if a patient comes to you, the child is just 4 or 5 years of age, the child is coming to you with a respiratory issue, means in this respiratory issue, sometimes we'll be giving an Ushna Prayagam. Example, let us say we are giving Indugandham Kashayam or we are giving Dashamula Kadatrayam Kashayam. We know this drug works based on the principle of Ushna Swabhavam. So the Shodagata properties attained with the help of Ushna Prayagam, isn't it? At the same time, this is a newborn child. This is a child who was not having any skin lesions yet. He is having a respiratory issue. We are giving Ushna Prayogam. This Ushna Prayogam may trigger some sort of allergic manifestations in some children. In some children means in those children who's having a genetical tendency to have increased immune response. Hope that is clear. That is, if 10 patients comes to us, out of them, for all those 10, we are giving Dashamula Kadatrayam Kashayam. Among them, 6 are okay, but 4 children are having some stimulations ending up in skin lesions. Such type of stimulations should not happen without asking proper questions regarding family history or without tracing details of the respective skin lesions in children. Because, as I told you, the skin and respiratory is seen overlapping in conditions as that of atopic dermatitis. It is very difficult to find out the details, but still, make sure that you have done your part by asking about the family history or a previous history of a skin lesion before advising some Ushna Prayogam in the case of respiratory issues in children, because that Ushna Prayogam itself may act as an allergic stimulant to precipitate the atopicity with respect to skin lesions. Generally, when compared to atopic dermatitis is a congenital disorder, but when compared to other congenital conditions, atopicity is not that much fatal in general. It is usually noticed as a self-limiting condition. As the age advances, the tendency to have presentations or the graveness of the condition gradually comes down. The only thing is that we should not irritate the respective skin lesion. That is what I have observed in my clinical practice. See, Acharya himself has told that you are a clinician, but you cannot cure all conditions. This has to be kept in mind. We always feel that if we couldn't cure some particular conditions, means it is because of our issue. It is not because of our issue. It is because of the respective issue of those particular vyadhis. This is the reason why Acharya has mentioned about the prognostic values, isn't it? Some disease has been mentioned as sadhya, some has been mentioned as asadhya. This means that the nature of the disease itself is having a tendency to either cure by itself or to remain as non-curable, isn't it? Among the 10 asadhya rogas, Kashyapa has mentioned Ati Krishnam as well as Ati Gauram, as well as Ati Romam, as well as Aromam. So these 4 titles should be kept in mind while addressing skin lesions, because Acharya himself has told us these conditions are asadhyam. But yet, we can try with the respective tool which is available. Now, coming to clinical cases, this was a 7-month-old child that was brought to OPD. Mother told us that the child is having dry redness, itching throughout the body. So we tried asking about all possibilities, including whether the child has worn a new dress, whether any new ahara was given, whether any close family history is there, any exposure to wind and all. No, everything, the answer was exclusive. The answer was no. Then again, we continuously asked. Then the grandmother told us that they're from a lower socioeconomic group. The grandmother told that, actually, doctor, we came to know that Ayurveda is good for children, but we were not aware about the principles of advising Ayurvedic approaches in this child practices. So our neighbor told that you can go for Ayurvedic soaps. That is the easy method without consulting a doctor. The child was on a very potent Ayurvedic soap which is available in the market in Kerala. And after 2 days, the lesion started. Just imagine the same picture being taken to some other systems of medicine, means they'll be applying some sort of steroids or local applications we made in some situations, which may modify the lakshana of the patient, because Nidhanam is continuously going on like this. This is the reason why the 3 noble principles of Chikitsa in Ayurvedam should go hand by hand. The first one is Nidhana Parivarjanam, second one is Samprapti Vigadanam, and third one is Dhadu Samikriyahi Esha Chikitsa. So these 3 domains, if goes hand in hand, means the complete relief is possible. It is just because of the continuous history taking, we came to a conclusion regarding the possible Nidhana. Here, we advised the patient to stop the usage of soaps. The dosham was identified professionally as Kavavittam. I didn't have a diagnosis. I diagnosed it as a Kavavitta Tvak Vigaram. Medicine given was prepared Guluchiyadi Kashayam with Gopi Chandanadi Guliga for mother. That was available at that time in the OPD. And after 4 days, the child was advised to do Abhyangam with plain coconut oil that is available at their home. And just after 8 days, you can see this. This is the first picture. After 8 days of, and here also, in the initial phase, no external application was given. After 4 days, Abhyangam with coconut oil was given. And after 8 days, this is the picture. So don't lose any points in taking history in pediatric patients. Another important presentation in the OPD is diaper rash, isn't it? Diaper rash, the technical term which we can use in Ayurveda is Gudakuttagam, Ahipudana and all, isn't it? The diaper rash, the chemical action that is happening is the urea is getting hydrolyzed to ammonia as well as isocyanic acid. That is known as ammoniacal rash. The best explanation of this diaper rash can be made from our experience itself. If you go to washroom, if you go to a public washroom, immediately after the washroom has been cleaned means you will not get a foul smell from there, isn't it? But what happens if you go after 2 or 3 hours of the washing of the public washroom, you will get the offensive smell of ammonia from there, isn't it? Why? This is because the urea in the urine gets hydrolyzed to form ammonia and isocyanic acid, which is giving the profuse smell. So what happens if this ammonia falls on the skin? We know ammonia is corrosive as well. So basically, diaper rash is a chemical burn. So we have to address this issue as that of a Dagdha Vranam. Dagdha Vranam. The Vranadobana Prayogas can be made with the help of Shardauda Kridam. Guluchyadi Kashayam was given to, this was a Kshirada. I think it is a 4 or 5 month old child, Kshirada. So Guluchyadi Kashayam was given to mother. Prepared Guluchyadi Kashayam was given to mother. In the mild or moderate cases, medicines given to mother itself may help in the condition. If it is much severe, small quantity, either drops or few ml of Kashayam can be given to the child as well. In severe conditions, even Jaluga Prayogam can be done in Gudakuttagam. Acharya has given us the liberty of using Rektamoksham. Actually, there are no much references in Kaumara Pratyam than this Gudakuttagam or Kugunagam, where the Rektamoksham has been mentioned. And in them also, Jaluka, that is the Rektamoksha Prayogam that can be used for Sukumara as Jaluka. So Jaluga can be used. I have not tried Jaluga in much a number of cases, but still, in severe cases, Jaluga is a Prayoga of choice. And try to keep it dry. Advise the patient to use diaper for a limited period, and that too from quality company. See, nowadays we can't advise the patient to take away diapers, isn't it? It's a challenge because if the patient is from metro and all, there is no other choice for them to dry the clothes and all. So I generally advise during the daytime, if they are not going outside, preferably about the diaper. In the night, they can use the diaper, but change the diaper every 2 or 3 hours, not beyond 3 hours. And if possible, don't use any plastic sheets to lay the child. This is a big question. Does Sudika Paricharya cause skin lesions in neonates or infants? Nowadays, Sudika Paricharya is one of the bread and butter for each and every Ayurvedic clinician, isn't it? Many private companies, many private doctors, even government hospitals are planning for Sudika Paricharyas. But I feel that the Sudika Paricharya should be modified in such a way that it accommodates the healthy condition of the child as well. Because many a time I have seen children coming to the OPD with the itchy, oozy skin lesions of the neck, from the axilla, from the groin and all. Immediately after, the mother starts Sudika Paricharya with the Tikshna Aushadas as that of Arishtas. So just have a look in the diet pattern or the Aushadha Prayogam of the mother. If you get a skin lesion in a child, especially if the child is a neonate or a newborn child. And if that is happening means we have to check the type of medicines advised in Sudika. The main culprit of such skin lesions is the Pitta Prakopi Garbhashe Shuddhigara Aushadas, because generally we give Arishtas, Jiraka Arishtas, then Abhay Arishtam, Pipalyasa, many such Arishtas are given for Garbhashe Shuddhi, isn't it? We will be just focusing on the Garbhashe Shuddhi without focusing on the Tvak Sarada or Rasa Sarada of the child. So that we end up in such conditions. Instead, in suspected cases, what we have to do, we can avoid Arishtas. If mother is having a Pitta Prakriti, if the child is having more of Pitta in nature, avoid Arishtas, avoid Tikshna Lehyas. Lehyam, Arishtam are all given during the Garbhashaya Shuddhi period, isn't it? Avoid Pipali and Panchakolam. We'll be giving Pipali and Panchakolam with the rice gruel, Kanyi and all, isn't it? For Garbhashaya Shuddhi. In such cases, generally, you can go for some Anushna Padana Prayogas like that of Tiktakam or the Panja Tiktakam. I feel that if we could modify such applications in Sudhika Parijadya, the comments from the allopathy pediatricians can be avoided to a great extent. Because whenever we take a newborn child, whenever we take a child who's feeding, that is Kshira or Kshiranada, to a pediatrician, many a time they'll be asking the questions like that, whether a mother is taking any type of Ayurvedic medicines. And the whole issue goes to the head of those medicines, isn't it? The culprit becomes Arishtam or Kashayams. So if you could just modify the application of these medicines, means definitely we can modify the acceptability of our science even in the modern picture. These are hemangiomas. If we see a hemangioma, sometimes it may cause much dysmorphism, isn't it? It may feel to be as a grave disease. But generally, hemangiomas doesn't require any treatment. It is a self-limiting condition. Hemangiomas doesn't require any treatment. Hemangiomas may require some sort of intervention if it is causing compression to some internal organs, or if you have an internal hemangioma and all. If it is solitary, or if it is few in number, means generally it is a self-limiting one. And interestingly, what I would recommend is not to irritate such hemangiomas, because if you try to irritate such hemangiomas, means that may end up in secondary infections which may lead to complications, because it is a vascular area. So preferably leave it as such, convince the patient. I'll show you one picture. This was the case of hemangioma which was taken in 2018. Just after 1 year, the picture was like this. 2019, it was completely cured without any medication. So hemangiomas are not dangerous generally. It is a self-limiting condition as well. Even though you feel it is a dangerous thing, but still it is a non-dangerous thing. You might have seen very small children with such mottling appearances, isn't it? This is a condition known as cutis marmorata. Due to the incomplete development of the neuronal supply, when the child gets exposed to cold conditions, that cold conditions need not be the extreme cold conditions that is expected by an adult, because the child is having an issue with respect to a condition known as hypothermia as well. So sometimes this can be seen in the normal temperature or within the room temperature itself. This is known as cutis marmorata. This is because of the incomplete or the improper circulation of the blood in the peripheral area. It can be addressed by daily abhyangam with either coconut oil or the very commonly available mild Ushna Prayogas like that of Eladithailam, Chembaratyadikeram, Parandyadikeram, Lakshadikeram, etc. can be used for application. But the important thing is, if this condition is not improving after abhyangam, means we have to think more on this. If it is persisting after initial years, means, or even after abhyangam it is coming down, but it is persisting after initial years, or the infantile period, means, there also we have to think about something else. We have to think about the concept of hypothyroidism, because many a time the initial skin lesions of cutis marmorata will be a lead to the clinicians in identifying hypothyroidism. So cutis marmorata generally is a non-dangerous condition, but if it is persisting after abhyangam, or if it is persisting after initial years, means a thyroid profile should be checked for. It is not to cure the skin lesion we are checking the thyroid profile, because we know that thyroid hormones are very much essential in improving the intelligence of the child, isn't it? In improving the brain functions of the child. So before entering into the learning period, or the best intervention which we can give in the early years, means that is the best possible gift which we can give to a child, isn't it? So identifying hypothyroidism is not just to cure the skin lesion, instead to help the child in modifying his brain functions. The same thing can be seen with the help of in cases of dry skin in children. Persisting dry skin lesions throughout the body, even after abhyangam, if it persists, means we have to think about the hypothyroidism issue. There also we have to go for a thyroid profile. Again, very common condition, oral thrush. The small white patchy lesions which we can see in the lips, in the gums, in the tongue and all, especially in the case of neonates or the Kshiranada group. These are known as oral thrush. Here also, the principle of addressing a skin lesion can be adopted, because we take the intestinal tract as, if we take it as the andatvak, we can apply the same principles, or in clinics, we get the same application of, or we get the same effect of applying the principles from Kushtam or Visarpa Chikitsa in such type of oral thrushes. Same again, the Tiktarasam can be given. These are the pictures of, this is the first picture is the child 16 days of age. The child was having oral thrush that was admitted in the hospital. And here the mother was undergoing Sudika Paricharya. At the same time, she was having a low backache. Here we modified the medicine after getting the consent of the Prasudandra expert. We gave Tiktakam Kashayam. Panchadiktakam Kashayam was given to mother. And see, just after 2 days, the lesion gets reduced and gradually it was subsided. Doctors generally does scraping in oral thrushes. They'll be scraping these oral thrushes and they'll be advising the antibiotic creams. Here, chance of a secondary infection is more. Instead, if we could address these lesions like that of a skin lesion means by just giving the Tiktarasa Pachana means, that helps a lot overcoming the complications due to scraping. This is before, the first one is picture is before, the second one is later. It happens in later part of life also. Umbilical hernia, even though it is not a skin lesion, it has to be discussed under the heading of the common skin issues. Because many a time, patient will be brought to the OPD and on seeing the swelling, if you examine, the contents will, nothing will be there inside the content. Because of the screaming or the abdominal pressure, it may come out. On examining, we cannot see any contents inside the that bulge. Just consult the parent and tell them that it will subside on its own, usually by age of 2 years. Umbilical hernia is only hernia, but it is a self-limiting one if it is not causing complication. Advise them to give slight manipulation by giving abhyangam with the respective oils that is used for the daily swastha vrtacharya. The brittle nails, discolored nails, or the pitted nails are common presentations in the OPD by children, isn't it? This should be treated as astikshaya. Here again, astikshayagarehi, kshiragradaihi, tiktavastibistada. Tiktarasam is again a good choice in astikshayam according to Sutrasthana. Generally, we used to advise Panchadiktakam Kashayam in the initial phase, which is not only addressing the Amavastha, but also Krimihara too. And interestingly, I have seen my teachers applying Nalpamaradi Kashayam and Saptachadadi Kashayam, even though both of them is not having correct reference for Pragaranam in the case of Astikshayam, but just because of the increased Tiktarasam of those particular medicines, it is found to get good results in the initial phase of such conditions. Of course, Krimihara Aushdas can be given accordingly, and the later part should be addressed with the help of Rasayanas, which is having affinity in promoting the pushti of Asti Pradhana Dadus. Of course, the common choices are Tila Rasayanam, finger millet powder, and we have other options in the market, which includes some vitamin D supplements or calcium supplements as well. Keshashadam, the patchy loss of hair in children can be addressed by a method of performing lekhanam. I used to do lekhanam with Shweta Kushtam. Shweta Kushtam is made into a powder and made into a potali. I'll be rubbing in those areas. And after that, the same method of ropanam as we do any type of prachanam or any type of lekhanam, jatyadi or honey will be given for lepanam. Then I'll be applying oils that of malatyadi keram, prapoundari keram, etc. externally. And internally, I'll be giving the medicines as that of Narasimha Rasayanam and all. So the local application of a modification of Rektamokshanam can be done in such inevitable conditions as that of the severe cases of Gudaguttakam as well as these type of Keshashadam. I told you, atopic dermatitis. It is one of the challenging diagnosis or disease in pediatric OPD. It resembles a congenital anomaly. It comes and goes off. The concepts of Visham, the concepts of Sahaja Vyadi should be taught in such cases. Unfortunately, a very good result cannot be expected in the initial phase itself. We can try for the modifications of medicine through the spectrum which was mentioned previously, like that of the Tiktakam Kashayam can be tried. Niltulasiyadi Kashayam can be tried, Avipatya Churnam, Gopi Chandanadi Gulika, all those things can be tried based upon the age of the child. Of course, if it is a Kshira Ada or Kshira Annada, the medicine has to be given to mother as well. Such modifications can be made based upon the pure observations made by the parent on day-to-day basis. You will be getting n number of cases with such presentations, isn't it? The small pinhead lesions which we can see over stick pani kurparam, isn't it? If it is more of Kandu, Kledam, Rujadigam, it is a case of Pama, according to Vagbhada. Here, the concept of Krimichigilsa, Kushtahara Chigilsa can be adopted. The Krimichigilsa is one of the most adoptable first line of treatment in any type of skin lesions in pediatric practice. Don't forget that. And keep in mind regarding the concept of phrynoderma, the vitamin A deficiency. So after performing the Krimihara Chigilsa, ask the child to modify their diet, which is rich in vitamin A, or in some cases, you can recommend some vitamin A supplements as which is available in the market as an over-the-counter nutraceuticals. So this is very much important. And if you feel a hyperkeratosis without that much kledam and all, you can try some sort of keratolytic applications. As I told in the list of medicines, Gandhaka containing combinations are having keratolytic property. The small white patches over the face, the small pinhead lesions over the forehead, over the face, the continuous white patch which we can see over the tongue, all these things are generally diagnosed as vitamin deficiency from the modern pediatric OPDs. Here, the best possible method to address them or to sustain the effect of medication is perform Krimichigilsa. Small white patches over the face. Again, Krimichigilsa by giving medicines like that of Nirgundyadi Kashayam, Amrita Rajanyadi Kashayam, Gopi Chandanadi Guliga, Krimikna Guliga, etc. can be tried here. Short-term usage of Avipatya Churnam, especially at night with respective adjuvants, can be tried here. Local application of Haridra is found to have good results. The most respected late Chigilsakas, especially those from the Visha Chigilsa background, is mentioning the application of Haridra because it is having the synonym of Nisha. Nisha means it can give color, it can promote color. So Nisha can be tried in such hypopigmented areas. And preferably here also avoid the soaps because the Twak Rauksham may aggravate the condition. All sorts of pathyam which is intended to prevent the exacerbation of Kavapitta dosham should be advised. You will be getting such patients, isn't it? Small darkish lesions throughout the neck, patchy lesions throughout the neck, hard lesions in the neck, and we go for a diagnosis of acanthosis nigricans, isn't it? The case of acanthosis nigricans, even though is identified as a skin lesion, the more important thing is that we have to check for other causes as well. For example, it may be an indicator of type 2 diabetes. This may be a clue for an insulin resistance in a child. So, before going for an external application or a Chigilsa intending in modifying the varnam of those areas, just advise them to undergo an evaluation of this diabetes or a thyroid dysfunction and all. Along with that, or addressing those issues, Kava Medohara Chigilsa can be adopted here. If it is an elder child or an annada where the arishtam is not contraindicated, the medicines like that of Aragvada arishtam, Ayaskriti, Lodra Asom, etc. works well in the initial phases, followed by the application of Eladi Churnam with the Amla Takram. Any type of skin lesion may aggravate with the continuous contact of some ornaments like that, isn't it? So advise them to take away the bangles, take away the chains and all to reduce the chance of a contact dermatitis again, because that may act as a stimulant to create more issues. A 3-year-old child was brought to OPD with these lesions. Actually, the mother was totally unaware of what was happening. the child was having mild fever. After the mild fever, mother gave paracetamol over the counter. Since this fever, before this fever, mother identified no issue on giving paracetamol. But all of a sudden, by giving the paracetamol, the child started to have these type of lesions. So an allergic tendency that was innate in the child was triggered by the administering of paracetamol. Means from that day onwards, the child is having paracetamol allergy. Previously, it was not noted. So you need not have an allergic response from the first day of life onwards to diagnose that case to be as allergic to something else. This is very important because the stimulant for triggering allergic reaction varies. I just put this picture to make that concept clean. I think that the picture is not there, isn't it? Can you see a picture there? Only the black circle is there. Is there a picture? No.
No.
No. Okay. I'm sorry. I missed that picture. Shvitram cases. As I told you, many a time cases like that of the principles of like that of Kushtam and Visarpam are used in Chikitsa. But if you get cases like that of Shvitram, the first thing what we have to do is we have to confirm the diagnosis. Shvitram is one of the most misdiagnosed case nowadays. Just seeing a white patch itself, doctors will be putting a query as that of vitiligo, or sometimes either the doctor will be putting a question mark as that of Shvitram. The patient will be going for doctor purchase, isn't it? The patient will be going from one doctor to another doctor. And on this course, sometimes one doctor may leave this question mark. So what happens? The next doctor diagnoses it as vitiligo. Usually, vitiligo, even though it is a clinical diagnosis, it is confirmed only with the help of a skin biopsy or Woods lamp examination. So, unless and until you are not sure about the vitiligo, preferably advise them to take an opinion of a skin specialist to confirm the diagnosis. Because Shvitram is a condition, as we know, it is a comparatively yapya or asadhya in nature. Generally, I don't have much experiences in addressing Shvitra conditions, but the principle which I adopt again is the same principle as that of Visarpam, but Krimihara Chikitsa, and I modify the application of external application. For example, in initial phases, I'll be giving a bit more Tikshna Aushadas when compared to a Saumya Bhava in the later part. For example, in the initial phase, I'll be advising them to apply this medicines like that of Villuadi Gulika with Tulasi Swarasam. Such type of applications are made in the initial phases. Later, followed by Rakta Chandanam or Chandanam, etc. in the later phase. So at the same time, it is a difficult area. It is a difficult area for us to address the general case of Shvitram in the OPD. This has to be kept in mind. Nowadays, from this month onwards, once the June arrives, once the rainy season arrives, we'll be getting these type of patients. These type of pitakas, Rektadushti, happens, or the Arumshika type of presentations is very common once the Rudu Vaishamyam or the changes in Rudu happens all of a sudden. In such cases, the child will be cranky, he cannot stay supine, he cannot sleep well. Here, the medicines are intended to reduce the Kleda Dushti. Guluchari can be tried. Nimba Patra Siddha Kvada Snanam can be tried here. External applications of medicines like that of Marma Guliga and Mukadi Purambada, as I told in the general set of medicines, is found to be highly effective in reducing the difficulty of the child. The Asyapagam, the most commonest cause of Asyapagam is any type of Vata Pitta Vriddhi inside the body of the child due to Saumya Dhatu Prashoshanam. The most commonest cause of Saumya Prashoshanam is decreased fluid intake by mother only. The increased intake of Katu Amla Lavana Aharam and the Ritu Vaishamya also aggravates the condition. So I feel that these Nidanas should be addressed before going for some external applications. And the best external applications you can give here are Gairiga containing combinations. Some very common or very effective patent drugs I have mentioned here. Smulser is a very good combination. It is having sweet in taste as well. Then the Guluche Drakshadi combinations can be tried. Avipatya Churnam can be tried in small dose on regular basis. Very, very importantly, Nidanam should be corrected. Child may come to you. Mother will be telling you about the occasional cough that is happening at night. Just ask the mother whether the child is having any skin lesions too. Just ask the nature of the skin lesion. The mother will be generally telling that the legs up to the knee joint or up to the thighs are affected with some sort of skin lesions. Initially, small macular lesions are noticed, which gradually increase the size. It may burst out due to itching. Then gradually it subsides by the time the child starts having cough. This is the classical presentation of a hookworm infestation that is happening in a child. When you have a detailed query with the, when you detailed interrogation with the parent, you can hear that in such patients, there is a history of close contact with the soil in areas where there are pets are more. For example, cow, dogs, cats, ducks. If they are fond of pets and if they are continuously exposed to such soils, means there is a chance of hookworm infestations. The severe itching during the evening hours and occasional cough at night makes the picture clear. Even though you don't get a clear presentation with respect to the examination, have a detailed history, make sure that the child is not exposed to the playing in the soil, playing in the infected soil. Of course, as the moderator in the initial discussion told that the exposure to soil is compromised nowadays, we have to make sure about the infections, chance of an infection. If you are sure about the absence of such worms or the cleanliness of the soil, definitely I too recommend the playing in the soil, because that is a method what we should advise being with the environment, isn't it? But in such cases, we have to be very particular, advise them to stay away from the soil. Just staying away from the soil may not be enough. We have to perform krimi chikitsa, including medicines like that of Padola Adikashayam and other Rakta Prasadaja prayogas, which we have discussed previously. Avagaham or kshalanam should be performed to reduce the itching. Nimbapatra, Haridra, Siddha, Jalam can be used for doing avagaham or kshalanam. That is the most common thing which we usually give here. Panasa Patram or Amlika Patram can also be added if the itching is profound. Then if you are staying in a place where such things are not available, means many drugs are available in the market, including the Nimba Patra Haridra Churnam. Nimba Haridra Churnam is available in the market. You can just dust it out and wash it off. So this is very much important, and don't forget about the possible nidanas and advise them to stay away from such infected soils. Actually, we all have heard this term ETN, isn't it? Erythema toxicum neonatorum. Actually, the term toxicum is a misnomer. It is not a toxic disease. It is a misnomer. Usually, these type of lesions are noticed in the early neonatal to neonatal period, and it subsides by 1 to 4 weeks. You need not do much interventions there. It doesn't cause much discomfort to child as well. Usually, the differential diagnosis becomes a miliaria rubra, but the miliaria rubra is an irritating one. The child becomes irritated, becomes cranky. But here, generally, the child is not cranky, and the palms and soles are spared also here. It is not at all a painful condition. As it is a self-limiting condition, you need not work much on the management of such conditions. Just console the parent and just convince them that it is quite normal to see such presentations. Just keep an eye. Whenever, if by any chance any infections or any aggravation presentations is noticed, then only you need to take a medication for the particular condition. This was a case that was brought to OPD with 40% burn. The child was praying in the evening. Suddenly, she got this burn from the lamp, and she was in the ICU. After her initial emergency AACHAARA chikitsa, she came to OPD. She was continuously having itching. She couldn't sleep properly. Irritation was persisting. In such conditions, the Nalpamaradi Churnam Snanam is found to be highly effective. It reduces the itching condition of such children, and the application of a government supply medicine which is available in the Aushadhi is burn cure ointment. It is very commonly used by the government medical officers. These two combinations were found to be highly effective. So minimal medicines were used to reduce even though we couldn't cure the condition, but as we know, sometimes a skin graft may be required in such conditions. Even in such conditions, symptomatic relief was given by the application of our medicine. Cons. Don't believe that cons happens only in adults. Cons can be seen in children too. The kadaram, the pressure point should be checked for cons. Generally, this is seen in children who are playing in sand or soils, or who are wearing this wet socks, or children who are not wearing socks and wearing the shoes. In such children, we can see the cons or kadaram. Local application of Vilvadi Gulika with Tulasi Swarasam can be made initially, and evening before going to bed, you can advise them to soak the area in lukewarm water. In minimal cases or in mild to moderate cases, this itself may cure the condition. Otherwise, if it is a severe one, I think that apart from medication, some Shalyandra perspectives are required in addressing cons. You might have seen parents coming and telling you that my child is having severe itching, especially in the posterior lower aspect of the thigh, bilateral or unilateral, since few days. This can be a presentation of toilet seat allergy. See, toilet seat allergy. Here what happens? Sometimes the child will be bathing as well as going to toilet in the same room. So what happens? If you bath, what happens? The moisture content, the impurities, the remnants of the soap particles, oil, everything gets accumulated over the covering of the toilet seat. It is a good source of fungal growth. So if the child goes and sits there, means if the child is prone for having an infection, already the child, I told you, the skin is very delicate. Skin is very delicate, and chance of an infection is more, means such children are prone for having these type of issues, and it is very common. Here, the first step of treatment is ask the parent to avoid the usage of European toilet. Advise them, if they are not having a provision of having Indian toilet, means advise the child to sit on the European toilet in a squatting position, and thus you can address the case along with medicines from the context of Visham and Rakta Prasadam. Medicines which we generally usually give is Nilitulasi Kashayam can be given, Gopi Chandana Gulika is given, Abhipatti Churnam is given. After that, local application of Durvadi Keram or Nili Daladi Keram is advised in the later stages. Along with the very simple or common things which comes to our OPD, sometimes we'll be facing some challenging cases as well, isn't it? This was a patient, a 9-year-old female child who was brought to OPD, and the comments of the parent was that the child is on some skin lesions of which the modern dermatologist is not aware, or they didn't reach a provisional diagnosis. So the dermatology department sent this child to the research wing of the respective medical college at Thrissur, and the child was on medication for 2 years. The details of medicines was not known to the patient. They were just giving some external application. Before that, the dermatology department tried in all possible ways to address the condition, but they couldn't find a solution for that. Then she was taken to the research wing, and some external applications was given there. Here, even after 2 years of continuous exposure to research and a couple of years before that to the dermatological department, the condition was not cured, and on the other hand, it was a bit aggravated. So when the patient came to us, we told them that I am not aware of the specific diagnosis, but still I'll have a try. On close examination, it was noticed that some Kleda Swabhavam was persisting locally in both the ankle area of that female child. So we started with Amrita Rajanyadi Kashayam, and Amrita Rajanyadi Kashayam was not given as such. We had Haridra Churnam to the Amrita Rajanyadi Kashaya Churnam, and that was boiled. That is 10 mg of Amrita Rajanyadi Kashayam, and half the quantity, that is 5 mg of Haridra Churnam was added to that and mixed well. And this is the medicine that was used for boiling and preparing the Kashayam. The intention of adding Haridra Churnam was to reduce the possibility of the Kleda Adhikyam locally in those areas, and that was given in the initial phase with Krimikna Guliga, and Krimishodhini Guliga was given as a weekly once dosage, followed by Krimikna Guliga was stopped, Krimishodhini was stopped, Amrutajanyadin Haridra Churnam was continued with Gopi Chandanadi Guliga and Neeli Daladi Keram. After 3 weeks itself, we could see a good change was happening in the child. And just by after 6 weeks, we also were surprised to see this change. So expect the worst in the OPD. You don't expect to have a miliaria rubra or an unitorum, ETN and all in the OPD. You can get any type of lesions in the OPD by examining the type of presentation. Just modify your prescriptions with the available medicines in the OPD. Yeah, I genuinely feel that you need not think about some very complicated medicines, which is mentioned the classics and all. Just try with the simple medicines, because you have an option to try with the simple medicines. You don't have an option to try with the complicated medicines. So try your option first. If it is not working, definitely you have to look into the other options as well. This is very common. They'll be coming to you with the discoloration over the outside the lips. This may be due to the discoloration due to drooling of saliva. The excess moisture should be removed, and causes of excess drooling should be addressed here. Many a time the age factor and CME should be addressed. This was another case that came to our OPD. When I was working at Ashtangam, this case came to the OPD. Actually, these modern diagnoses are not made by me. So I'll be helpless if I get some queries with the modern diagnosis. I'm not making modern diagnosis. We'll just see the patient, we'll examine the patient, we'll be taking a detailed history. And after that, I'll be seeking opinions from the respective dermatology friends from the modern fraternity by just sending them the pictures, and from them I'll be getting a diagnosis, because we are not trained in such a way, because I told you I'm not an Agadandra expert, I'm not a dermatology expert, but still I'm trying my best with the limited tools that is available within me. So this was the case of bullous impetigo. Small vesicular lesions started in the child. It was noticed over the face. It spread towards the neck. The spreading was very fast. The same lesion was noticed in elder brother too. Same lesion. So we understood that it is a Aupasargika rogam. It is a contagious disease. And the lesion was resembling almost that of a Lutha Visham. But the spread was not that of a Lutha Visham. In the case of Lutha Visham, the spread is generally centrifugal in nature. Centrifugal, from center to periphery. But the spreading nature was not the same. But still, we thought that it is an acute onset, isn't it? Acute onset generally happens with the exposure to Visha-like substances, isn't it? So again, we tried here Nil Tulasiyadi Kashayam with Vilvadi Gulika. Actually, you can see in front of the left ears, it was a big vranam. It was a big vranam within a time period of 3 days. The same lesion was noticed in the elder brother, means the child went and took an antibiotic, and that was subsided. But when the same disease happened, the younger child, means they took the child to our OPD and we observed the child. So the lesions were almost like vrana, especially the big one was just in front of his left ears. We thought about a Punadavartaka Jvara Swabhavam, but the medicine was not available. So we tried again with the Nilvasadi Kasham and Vilvadi Gulika, followed by Gopi Chandanadi Gulika, and again Sneham, which is mentioned in the Visha Chikilsa, which is Pajanam with respect to skin lesion. The Niridaladi coconut oil was applied. You can see the difference. The first picture was taken 10 days back after the induction of medicine. The second picture was taken 1 month later after the initiation of medicine. The vrana was almost completely cured by the application of Nilidaladi coconut oil. This is the first picture, second one and third one. Hand-foot mouth disease. Hand-foot mouth disease is very common, very common. It is just a viral infection. I think that you need not give much stress in advising medicines in such conditions if it is not complicating, or if it is not disturbing, or if the child is not irritable. Just try some Jvarahara Aushadas and convince the parent that this is a self-limiting condition. It is a viral condition, of course, chance of spreading is there. So isolate the child. If other children are at home, just isolate the child. And you can try medicines like that of Sudarshanam Guliga can be tried here. Guluchiyadi Kashayam can be tried here. Gopi Chandanadi Guliga can be tried. Preferably avoid any sort of external applications. We can go for some sort of kshalanam Sthanika Avagaham can be done if the child is not having fever with the respective Nalpamrata Churnam or the Jalam prepared with the Nimbapatram and Haritra. That itself may help in overcoming such situations. It is very common in the OPD, HFMD. Hand, foot, mouth disease. It is caused by the Coxsackie virus. It is a viral disease. This is a set of medicine. And at the end, you can give Rajanati Churnam or any type of Rasayanas which is having affinity in addressing the Tvak Vigaras as well. This was a really interesting case that came to our OPD in 15/10/2021. The child was a daughter of a bus conductor who was working in a bus that was going in front of our Vaidyaratnam Ayurveda College. The child was having small blisters. The onset was acute. The blisters were noticed in the joints, especially in the elbow as well as the knee joint area. The lower limbs was also spared. And the child was taken to many doctors, many modern doctors, and they tried applying some medicines, but the condition remained the same. They took the child to district hospital. They told that no other option is there. You should take your child to the medical college. And at the medical college dermatology department, they asked the parent to take the child for a biopsy. On giving the sample for biopsy, while they were returning home, they came to our OPD and they told me about the condition. So at the time of first visit, I was not aware about the diagnosis of this condition. I took it as an Agni Visarpam. In this condition, the medicine again it was an acute onset. This was the medicine that was given, Nilidalasyadi Kashayam, Guluchyadi Kashayam, Dushi Vishari Guliga, Nilidaladi, as per the condition. But after 3 or 4 days, the parent came and told that this is the biopsy report, and biopsy report states that it is a case of linear IgA disease. This condition is noted to be as a rare disease. That is, it happens with an incidence of 2 in 1 million. I was totally not aware of the particular diagnosis in modern perspective. When the parent came on the 5th day, actually, she was, the mother was a bit happy. She told that the doctors from medical college told that your child cannot be cured by any way. She requires long-term steroid therapy, but still the recurrence may be expected. But doctor, since commencement of our medicine since last 5 days, it is slowly healing. That is the interesting thing. But once I went through the biopsy report, I told them that it is an autoimmune condition. It is a condition that may aggravate at any point of time. We have to stick on to the respective medicines. We cannot assure any complete cure for this particular condition. All such comments to safeguard from the side of a clinician was made. After 1 week, it started healing. After 2 weeks, almost completely healed. After 4 weeks, the first 2 pictures was taken after 2 weeks, and the third picture was taken on 10/4/2024. Touchwood, no recurrence was noticed even after 3 years. Even though the child is not on any medication, the child was continuously on medication for 4 months. 4 to 4.5 months, she was continuously on medication, but touchwood, no recurrence was noticed. And this was published in an international journal recently. I'll just share the thing. Visarpam. This was a child who was brought to OPD with oozing skin lesions. Initially, the child was having small macular-papilla lesions. The child was taken to a traditional Twakroga expert or a Paramparya Chikitsaka in Thrissur district. He was very famous for treating skin lesions. And he advised some medicated oil to be applied. And after application of oil for 2 days, the oozing increased. Child started to have fever. Infective points were noticed. And the first picture actually is not the fresh picture. It was the picture taken after 1 week of our medication. I couldn't take the first picture. Here, Panchadiktaran Kashayam was given with Ariyaradi Guliga. I felt addressing Krimi too, along with the Pajanam with the help of a Tiktarasam. Kshalanam was made with Nibapatra Siddhakwadam. Only 2 medicines were given internally along with Kshalanam. You can see the improvement. Here, Chembaratyadi Keram was given for external application. Once the complete healing was noticed, or once a child started to have dryness in his body, you can just see the difference. This is yet an interesting case. The mother brought the child to OPD. Again, from Ashtangam only. The child was brought to OPD. Some interesting cases. I was fortunate to get some interesting cases at Ashtangam. The child, he was having small reddish lesions in his lower cheeks, in his either cheeks, on his forehead as well. So the reddish lesions, when I was inquiring about the possible nidanas of these lesions, mother was smiling and she told that actually the child got this lesion due to sunburn. The child and his elder child, this child is, I think he was 2 or 2.5 years at that time, and his elder child was 4 years. So both of them made a competition telling that who will look into the sun for more duration. And the sunburn happened. So they came to us. If we don't get a correct nidanam, or the possible nidana means sometimes we'll be ending up in much confusions, because as I told you, the pathology and physiological reactions happening in a child is a difficult thing to be separated. So go on inquiring about the possible nidanas, go on inquiring about the suspected issues. Then the treatment becomes very easy. Just by applying Shadavada Kritam with Yashada Bhasmam, the condition was addressed. Otherwise, I'll be thinking about the hand, foot, mouth disease. I'll be thinking about miliaria rubra. I'll be thinking about some complicated conditions and all, isn't it, if I couldn't get a proper history. But just because of the proper history that was given by the parent, the situation was handled smoothly. This was a case of plantar psoriasis. Actually, this patient was the son of a modern gynecologist who was working in Thrissur in a private hospital. The doctor came to me with these skin lesions in her child. Initially, she was hesitant in following the pathyam and all. She told that the first visit, she told me that she is from modern fraternity, and almost all doctors in Kerala, almost all reputed doctors have tried their best, and the diagnosis was made was plantar psoriasis only, and they told that this may recur at any point of time. Even though we give some sort of steroids, some sort of external applications, there is a chance of recurrence. So can you give assurance in improving this condition? Actually, I couldn't give any assurance because, as I told you, we are just clinicians, and we are trying our best with the available resources or the available knowledge, isn't it? So I couldn't give her any assurance, but still, fortunately, she was willing to try our medicine for a period of 2 months. Here, the child was hesitant to take kashayam. Here, I gave Aragudadi kashayam tablet. Guluchiyadi Panajalam was given along with that. Abhipatti Churnam was given. These were the 3 medicines that were selected during the initial phase. Of course, Avagaham was made with Nimbapatram and Haridra Siddha Jalam. After the initial phase, I advised the parent to give the child some gridam. Again, she was hesitant, but the hesitancy was less when compared to the previous visit because she could see the improvement in the child. So she told me that, doctor, is there any other option other than the gridam? So I switched on to the gridam capsule that is available in the market. Araguda Mahadikta gridam capsule was given as Vicharana Sneha. Then 2 moisturizing applications like Sora herb oil and Vinsori oil was given. Routine deworming was continued. Even now, he is under my treatment. The routine deworming is continued. Along with Giloy Sattvam is given regularly. Just by 4 weeks, we can see great improvement in his presentation. Since last 6 months, the child didn't have any recurrence. He is under my treatment since last 6 months. In the context of the common medicines in my presentation, I mentioned about a medicine known as Makipuvadi Kashayam. Makipuvadi Kashayam is a good drug of choice in a disease known as Agakkarappan. Karappan, as I told you, Karappan is the technical term which we can give for any type of skin lesions. And Agakkarappan is a condition which is mentioned in the classical, in the traditional textbook of Kerala in pediatric practice, known as Vaidya Taragam. It says that the child will be having GIT issues as well as skin lesions. The fever may be daily. It may be seen on the frequent days. The body pain will be there. The child will be cranky. Adhisaram will be there. Constipation will be there. Frothy stools can be noticed. If these compound presentations are seen together, the possible diagnosis can be Agakarapan. This was a case of Agakarapan. A 9-month-old female child was brought to OPD with continuous fever. Gradually, fever subsided. Skin lesions started to appear. Fever was on alternate days. The child was cranky. Hard stools was noticed. After the initial period of hard stools, gradually the frothy bowel movements was noticed. The child was straining without any cause. Pravahanam was there. Abdomen was distended and skin lesions. This is the same picture that was told in the context of Agakarapan. The drugs that was prescribed were Makki Puvadi Kashayam for mother, Gopi Chandanadi Guliga for child, and Bilvadi Guliga was given to mother. Rajanadi Churnam was given as Panajala. These were the only medicines given to Agakarapan. Unfortunately, I couldn't share the medicine, share the picture after this. And we are publishing a paper on this Agakarapan case, like as a case report. So we have to keep in mind regarding the concept of Agakarapan, that is, presence of skin lesion along with GIT issues may be a lead to the diagnosis of Agakarapan. And Makki Puvadi Kashayam is a good drug of choice. In a single patient, you can see multiple presentations. This was a patient who got discharged recently from our hospital. The child was having these type of lesions. Over her elbow, dark lesions were, raised lesions were noticed initially. Over her hand, this discoloration was noticed. The biopsy report states that she has two conditions, psoriasiform dermatitis as well as incontinentia pigmenti. So don't expect the same lesion present throughout the body. The same child will be having different lesions. We gave Takradhara. Achasnehapanam was given. She was a 12-year-old female child. Achasnehapanam was given. The maximum dose given was 80 or 90 ml. After that, Abhing, Ushmasudam and Virejanam were given. Child is symptomatically better after the initial course of treatment. Urticaria cases comes to our OPD, isn't it? The urticaria, even though we feel that it is not that much grave, but still in children, we have to think about some warning signs in urticaria. Especially if the child comes to you with edema in the periorbital area or just around the oral cavity and all, that may be a warning sign. Very, very important, that may be a warning sign. If you see such patients with the swelling over the periorbital area or the mouth area, you can examine the mucosal areas as well. Just ask the child to open the mouth or just open the mouth of the child, and if you examine and if you see a reddish lesions or hyper-intense reactions noticed in the mouth, means that is a condition that requires some Atyeka Chikitsa. Sometimes the child will be in need of a anti-allergic medicine like that of antihistaminic drugs from the modern perspective. So if the urticaria, if is that much severe, means preferably advise them to have an initial course of antihistamines, then come to us to have the follow-up. Otherwise, if it is a mild urticaria, means it is a good area, or it is one of the best areas where we can give wonderful results. Again, Ambadra Kashayam is a good drug of choice. Here also, based upon the Klera Swabhavam, we can add Haridra Churnam, or without Haridra Churnam also, we can prepare Ambadra Kashayam. Nimbarajanyadi Guliga can be given in the initial phases, followed by the same Kashayam with Gopi Chandanadi Guliga. Avipatti Churnam is given continuously for having a frequent anulomanatham, or to restore the Agni Balam, or to purify the gut flora. Small amount of Avipatti Churnam is given frequently as anulomanam at night. The white patches, which may be circular, which may be oval, on close examination, we can see small scalar plaque-like lesions over these white patches, means that may be a condition of pityriasis alba. The differentiation of pityriasis alba with other conditions is that it will be having a clear demarcation, a clear boundary will be there. Sometimes it will be itchy, sometimes non-itchy, but for sure some shiny plaques will be there. This is comparatively a non-dangerous condition, which is self-limiting one. Moisturizer applications, doing routine krimi chikitsa, and don't forget, advise the parent to make the child not to get exposed to sunlight. As I told previously, in the Rektavas and all, we have studied that, isn't it? But exposure to sunlight may lead to skin lesions. Means here, the exposure to sunlight may aggravate the condition. Then, in majority of the cases, have a vitamin D profile. Sometimes it will be on the lower side. Give some vitamin D supplements because vitamin D supplements helps in improving the melanin synthesis. And one important thing is that if this pityriasis alba is persisting or increasing, there are studies which states that this pityriasis alba may lead to vitiligo. So proper care should be given even though it is not a non-dangerous condition. Such type of precautions should be advised to the respective parents. Other common lesions which we see, small whitish lesions over the face, melia, I'll just wind up now. Subsides by 3 to 4 months. Miliary rubra, they are the heat rashes. Coconut milk is a good choice. Coconut milk is a good choice with Ixora flower. It is having the antimicrobial or antibacterial property. Chickenpox infection, even though it is not a pure skin lesion, it is an exanthematous fever. It is a fever with a skin lesion. Respective medicines like that of Chandana Varpadagadi Kashayam, Guluchiyadi Kashayam, etc. can be tried. Measles, the same thing. Measles is very commonly seen after measles vaccination nowadays. Nowadays, in India, we don't have the exact measles vaccination, I think. We are having the MR vaccination. So after MR vaccination, it is not that much seen. But after having exclusive measles vaccination, we have seen presentations resembling the measles. Molluscum contagiosum, the Ajagalliga, the external application of yashti with the help of a coconut leaf is found to be highly effective in removing the molluscum contagiosum, even though we don't get much number of molluscum contagiosum because the parents are very fond of going behind homeopathy medicine and addressing molluscum contagiosum. But still, if you get some patients, yashti can be applied externally by just doing bharjanam, by frying in ghee, and all methods to improve the recta prasadam can be adopted here. Dandruff and all, we have to go behind the respective cause. Sometimes the fungal growth will be the contributing element. The immune status of the child should be addressed. The nutritional issues should be addressed. And krimi chikitsa should be done. Then only go for an external application. And otherwise, what happens is that if you try for an oil application, the initial phase itself means that may aggravate the condition, or sometimes that may end up in hair fall and all. Without giving a proper instruction regarding the possibilities of dandruff means the medication will not work properly. Bhujagaladi Keram, Durvadi, Durdurapatra are the good choices, but don't forget the Durdurapatra is more Ushna in nature when compared to Bhujagaladi. Bhujagaladi is one of the best choice that can be used in addressing dandruff. The small scaly lesions which we can see over the scalp of the child during the initial infantile period, during the 3 to 12 months of age, is known as cradle cap. You need not work much on the cradle cap, just convince the parent that this is quite normal as a part of normal abhyangam with the respective coconut oil or the oil that is used by the parent itself, the condition may subside. Tarunyapidaka, a very common condition in the teenage, the addressing the condition with medicines including lodram, takram, kshalan with takram, some special face washes which doesn't make the skin dry. Along with that, advising a proper diet, sleep and bowel pattern is much essential in addressing Tarunyapidaka. In this era where the gadget usage is much more, the black circles are very common around the eyes, isn't it? So the technical part have to be addressed accordingly. Along with that, a pack of Mukadi Porambada can be made because nowadays we are gaining much momentum in the cosmetology area also. So the application of cosmetic principles can be adopted here. A pack of Mukadi Porambada can be used with Kshiram or sandal with Navanidam can be applied in the black circles along with proper rest and diet. I'll leave this. In the skin manifestations, don't always think that they are just skin manifestations. Sometimes skin manifestations will be giving us a clue regarding some underlying congenital anomalies as well. For example, if you could notice a tuft of hair in the lower sacral area, just above the buttocks, it may be a clue of a spina bifida. So instead of going for some methods to remove the hair, ask the parent to go for a detailed evaluation to rule out the possibility of a spina bifida. It is a congenital condition which may lead to complications as well if not properly addressed in the initial phases. Small brown patches, either oval, which is large in number, or gradually increasing in size, may be a clue to a growing neurofibroma or a future neurofibroma. They are known as cafe-olate patches. So some skin management will be helping us in identifying some major congenital anomalies as well. You will be getting many questions from parents of newborns nowadays, isn't it? They'll be asking you about the birthmarks. Whether birthmarks is noticed only at birth, the answer is no. About 90% of children, you can see birthmarks at birth only. But it is actually a misnomer. A birthmark can be noticed at birth. It can be noticed after a few weeks, after a few months. And there are evidences which states that birthmarks has been noticed after 3 or 4 or 5 years. Sorry. Some of the common birthmarks include the salmon patches, which we are very commonly know, all those things, isn't it? That is noticed over the nape of the neck or back of the head. The angel kisses over face or pinkish. I just reduced the pictures because if more pictures are there, it will not be possible to share the slides. So I feel that you can go to the Google and search all these terms and all. It is quite common to see all these type of birthmarks in a child. Mongolian spots is very common. We can just see the lower back of the child with the blue-gray, irregular, wavy bordered lesions. They're known as Mongolian spots. Generally, all these birthmarks are self-limiting and you need not work much on managing such lesions. We have to know that this is a common lesion, this is physiology, it subsides on its own. That is also an important part of treatment, isn't it? Apart from that, there are some other lesions. For example, moles. We know we are very common about the moles, isn't it? The medical term of mole is congenital nevi. Generally, moles are benign. Moles doesn't cause any issue. You have to address the mole only if the size is more than 8 centimeter. It is benign if it is less than 8 centimeter. If it is more than 8 or 9 centimeter, it requires detailed evaluation. Or if the number is gradually increasing, means that also requires detailed evaluation. Port wine stain is another birthmark which can be noticed, but it is not having the same prognosis as that of a salmon patch or Mongolian spot. The wine color discoloration over face or other parts which persists throughout the life or may darken as age advances is known as port wine stain. Port wine stain may be associated with some associated feature of a genetical anomaly. For example, the Sturge-Weber syndrome is a syndrome that can be seen with port wine stain. So if you see a port wine colored stain over the face or over the neck of the child, means that should be evaluated properly. The child should be sent for detailed evaluation. Sometimes that may be a clue of the underlying pathology like that of a Sturge-Weber syndrome or a Klippel syndrome. And there are studies which states that if the port wine stain is there, there is an increased risk of glaucoma as well. You'll be getting patients asking for medicines to improve the complexion of the child, isn't it? Never ever fell into the gimmicks of such parents. Tell them the importance of character and the significance of living in an era where character is more important than complexion. How I can maintain my child's skin good? This is a parental concern. We know about the basics of modern things, the looks concern, everything is there. But Arogya Lakshanam of Kashyapa Samhita says that Suprasanna Indriyatvam as well as the Bala Varna Ayusham Labaha are the features of a healthy child. So a healthy skin reflects a healthy child. This has to be kept in mind. With this understanding, some methods should definitely be advised to the parent to maintain the child's skin in good condition. Sufficient quantity of water, of course, we miss this recommendation means we are missing the 90% of recommendation because we know that the greater portion of the body of the child is contributed by the water. And don't forget that the first outer layer of Twak was told as Udagadhara by Charaka. So water is having a very crucial role in maintaining the health of the child. If you get a patient of constipation, if you get a patient of dry skin, means the first prescription should be increase the quantity of water. If in this case of a Kshirada or Kshiranada, ask the mother to increase the quantity of water, especially the case of Kshirada and all. In the case of a child who's less than 6 months of age and all, if dryness of skin noticed, if constipation noticed, means many a time the mother will not be taking sufficient quantity of water, because there is a thought among the households that if you drink more quantity of water, the abdomen will not be reduced. The involution of the uterus will not be reduced. So they'll be taking less quantity of water, and this decrease will be to an extent that the sufficient quantity of water is not obtained for the child, which may end up in dryness of the skin or as well as the constipation. Rudu Swabhavam should be considered because there is a chance of a transdermal water loss. Methods of improving the personal hygiene, including the Abhyangam, Snanam, Dhuvanas, various type of lepanas, and Pradimarshanasam. Pradimarshanasam, we all know, it improves the function of not only the skin, but also the nervous system functions. If you are not sure about oil, if you are fear of using a thailam, because we know thailam or majority of thailam are pitta prakopa, you have a choice from coconut milk. When compared to oils, coconut milk is more snigdham and guru in nature. Of course, it is having this antibacterial and antifungal property along with an anti-inflammatory property. Never advise the child, never expose the child to a sunlight with UV index more than 4. We feel that the child should be exposed to sunlight to get sufficient vitamin D, isn't it? This exposure should be made with in a UV index of say 3 to 5 or something like that, not more than 4. So the best time to expose a child is during the early morning hours or the late evening hours. That depends upon your climatic conditions, your desha swabhavam and all. It is not universal. It depends. The good sleep according to age, very important. A newborn child should sleep around 20-21 hours. At the same time, a school-going child should sleep around 8 to 10 hours. So age is a factor which determines the duration of sleep for improving the general health as well as the quality of skin. Screen time should definitely be reduced. The routine deworming, no unwanted cosmetics. The pediatric cosmetics of the children's cosmetics is a big industry nowadays. When I went to Chennai, the picture I plotted is a picture I was taken from Chennai. There is a separate area in a supermarket to sell the cosmetics in children. They are having hair gels, they are having face creams, they are having deodorants. So if you get a patient with irritation or skin lesion in the axilla, just think about the possibility of having a deodorant or antiperspirant gel that might have used by the child. And nowadays parents are buying all these things just to showcase the social level. Low-fat dairy products is a good contributing element which is rich in vitamin A to improve the skin quality. The fruits rich in antioxidants like berries, seasonal fruits are good choices. Nuts, which are very rich in essential fatty acids, including walnuts, salmons, and flax seeds can be used. The concept of skin microbiota. Concepts of skin microbiota is very much important because we know that the quality of the bacteria, quality of the sebum, quality of the sweat, all these things togetherly contribute to the skin microbiota. The skin microbiota is forming the first line defense mechanism, isn't it? So that should not be forgotten. So continuous washing with the soap, continuous non-exposure to such or continuous absence of sweat, all these things may inversely affect the skin health. We know that Sneha Saro Ayam Purusha, the Mrudu Sneha Swabhavam is the healthy feature of not only the body, but also the skin. The application of Rasayanas like Suvarna Prashanam has been stated to improve the quality of Balam, Varnam and Twak, integrity of the Twak. Vruddha Chanakya states that Yadannam Bhakshayet Nityam Jayade Tadrishi Prajaha. The quality of the bijam is determined by the quality of aharam. Bijam means the quality of the Shukla Dhatu or the quality of the Shukla Dhatu which is ready for reproduction, isn't it? So the type of aharam can determine even the Shukla Dhatu means the type of aharam will definitely reflect the type of body parts including the skin. In the Garbhini aharam, the first Panja Bhaudikatam of the Garbham is contributed by the Mahabhudas contributed from the Bijam, which is gradually increased by the Mahabhudas contributed by the Aharam from the mother. So the contribution of the bijam is determined by the contribution of the aharam taken by father and mother, which is transmitted to the bijam. At the same time, the contribution of the aharam reflects the future development of the Panchamahabodham of the child. And within 2 slides, I'll be ending my presentation. This is an important message because don't forget that leprosy, any type of leprosy can enter your OPD at any point of time. So if we see these 3 presentations, definitely loss of sensation, a hypopigmented or reddish skin patch, along with thickened or enlarged peripheral nerve with loss of sensation and or weakness of muscles supplied by the nerve, and microscopic detection of bacilli in a slit skin examination are the diagnostic features of leprosy. Nowadays, the leprosy number is increasing in Kerala. I think the same picture can be seen nationally too. 2018, the statistics says that the leprosy cases is increasing. So if we come to see the possible presentations as that of in leprosy means, preferably refer the child to a higher center for detailed evaluation, especially that like that of a skin biopsy may be needed to confirm the diagnosis. But we have to keep in mind that leprosy is not eradicated. It is still there around us. These are the 2 publications which were made by us recently. The first one is on management of linear IgA disease, as well as second one is Luta Vishna management. So before I end, I think that this will be the message. Even Sitaram has conducted 181 seminars. During the COVID period, we are exposed to webinars, at least 2 or 3 webinars per day. Nowadays, we are getting continuous links for webinars. So the need of webinar, as we know, it is on the high end. But on the other hand, as takers, we have to take the principles of these webinars, use your common sense. The yukti has been told by Charaka as the best pramanam, isn't it? You have to use your yukti, modify the applications as per the need of your patient. This is the message. You need not be a dermatologist. You need not be an Agadandra PG. You need not be an expert in addressing skin lesions, but still the try should be made just by having a spirit inside you. I want is a tramp. I can't is a quitter. I don't know is lazy. I wish I could is a wisher. I might is waking up. I will try is on his feet and I can is on his way. I will is at work. So let us start from today onwards. Thank you. I'm sorry that if I have taken much time. Now the time is 1 o'clock.
Not at all. Not at all, Dr. Arun. It was a very wonderful presentation with the you have well-rounded all the topics. Initially, we started with the discussion of general line of approach to the pediatric dermatosis and even the pediatric illnesses in general. And later, you carried over the discussion to the medications, thereafter to specific cases and their management. So I think the take-home message is also very strong in the sense that what all things you have conveyed, they are all happens to be an input for further learning. And I think some finer conclusions of this this webinar may be the importance of prevention of pediatric dermatosis, as well as the need for very correct, precise Ayurvedic diagnosis. Maybe there are certain diseases wherein a dermatologic diagnosis may be possible by using skin biopsy, but there ends the story. It cannot move forward because the patient is not getting true results, or rather sustainable results. You apply some topical steroids or something and the lesion will be subsiding only later to come back. So nowadays a great amount of people are focusing on Ayurveda so that they may receive lasting benefits. So for that, all the things which have been mentioned by Dr. Arun is extremely essential. I think the dietary modifications, the lifestyle changes, the oil application, the food pattern, the specific food pattern to be followed by children and all of us in the house, interaction with the environment, as well as the mental making up of a child. Everything is very important in this current scenario to prevent the not only pediatric dermatosis, every other illnesses affecting the children. So I once again thank Dr. Arun B for sharing your wonderful insights regarding this particular topic. And for the time being, I may invite Dr. Aditya Suresh to have a very brief product introduction. Dr. Aditya?
Yes, sir. Yes, just a
Yes,
moment.
yes.
Sir, is it visible?
Yes.
So, to begin with, I will begin with Sora herb oil. This is one of the best medicine for apply for the skin disease. So this is a unique anti-psoriatic herb, Shweta Kudajam. Shweta Kudajam prepared through Aditya Pagam in coconut oil. It relieves itching and inflammation, reduces scaling and discoloration of skin, regenerates healthy skin, and prevents relapse. A time-tested tradition, now standardized and clinically proven. It is effective mainly in psoriasis and dandruff. Externally, for apply sun bath if possible. Take bath after 1 hour. Internally, 5 ml BID with 30 ml hot water. Next one is Dermosap ointment. Skin-friendly combination of Mahatiktakam, Tanganam along with Shweta Kudajam and coconut oil. Gets rid of itching and scaling. Heals and cures the skin. Effective in tinea, candida and ringworm infections. Topical broad-spectrum antifungal. Effective for external application in fungal infections and psoriasis. Dosage apply over affected area 2 times daily. So next one is Alarkan powder and tablets. Antihistamine action of Haridra supported by Triphala and Trivur added with Gokshuram and Kasisa Basma. Very effective in allergic pruritus, dermatitis and urticaria. Strong action in allergic rhinitis, eosinophilia and asthma. Develops adaptive immunity power against allergens. Palatable, non-sedative natural protection against allergies. Effective in respiratory and skin allergies. Tablets 2 BID, chewable tablet 1 gram. Powders 5 to 10 gram BID. So here describes about the phytochemical study between Alarkan tablet and Haridra Khandam. So what we did is to study the phytochemical and HPTLC of Alarkan tablet and Haridra Khandam. So study the antimicrobial activity of Alarkan tablet. Clinical study of Alarkan tablet against allergic conditions. So here it is 1 gram, as previously I told, 1 Alarkan tablet is equal to 2.5 gram of Haridra Khandam. So the methods we adopted here is phytochemical, HPTLC, antimicrobial, clinical study. So in phytochemical, methanolic and water extract were prepared with 10 gram sampling, Soxid apparatus and standard protocols were followed for the qualitative phytochemical analysis. So HPTLC study was also done. 10 gram Haridra Khandam sample and Alarkan tablets were reflux separately. So it was taken separately 100 ml methanol. That's for half an hour, that's 30 minutes. HPTLC fingerprints were developed with curcumin standard on Camangle element, 5 gram using silica gel, 60 GF 254. Then another thing is the antimicrobial. Methanolic extract were used by antimicrobial activity using Kirby-Bohr method. Next is clinical study. Open label clinical trials were carried out in Bharatiya Vidyapith Deemed University in Pune, involving 26 patients, which was aged between 18 and 70 years, presented with symptoms and signs of urticaria, that's Shidapitham. Specified dose of Alarkan was given to the patients for 15 days. Subjective parameters like Varadi, as we know, Varadi Dashti Samsthana, Kandu, Todam, Vidaham, Lalima, and objective parameters like absolute eosinophil count and IgE were assessed on 16th day. So result thing is the phytochemical. In phytochemical category, 12 phytochemicals including sugar, reducing sugar, quinine flavonoids, phenol, alkaloid tannin, steroids, coamines, glycosides, starch, and carbohydrate are present in aqueous extracts of both products in their methanolic extract. Both include 8 common phytochemicals: sugar, reducing sugar, quinine flavonoids, phenol, tannin, coumarin, and glycoside. So in that graph proves that Alarkan is highly effective in sign of urticaria. Also shows remarkable reduction of IgE count and total eosinophil count. From coming to Varadidashta Samsthana, and it has been seen a remarkable reduction in Kandu also. Kandu, Todam, Vidaham, IgE, and finally in total eosinophil count. it is seen that there is a total remarkable reduction. As at present, Alakan contains various phytochemical compounds. HPTLC analysis proved 10 gram Haridra Kandam. That is 10 gram Haridra Kandam is equal to 4 tablets. That is 4 Alakan tablets. Very effective antimicrobial activity and a promising remedy for allergic conditions and urticaria. So it comes in 1 gram tablet. This chewable tablet is 2 BID. Powder it is 5 to 10 gram BID. So I am moving to my next product, Helmolate. It is very effective and helminthic, especially for children, teenagers. Effective and helminthic, it mainly contains Dadima, Vidanga, supported by Trivurt and Nimpam. So it's effective in eliminating various intestinal worms, quickly eases associated gastric pain and vomiting, relieves sleep disturbance and itching. So next I like to move on to our Yoga Amritam classical products. So first is, as we all know, this is Dushi Vishari Gulika. Pipalyo Dhyamagam Mamsi, Rodramela Swarchika, Kudanadam Nadam Kushtam, Yeshti Chandana Dushi Visharir Namna Ayam, Chachanya Matrabi Varyate. So as we all know, Dushi Vishari is one of the best medicine for allergic manifestations, skin disease, food poisoning, and Ludha Visha, etc. So it mainly contains, as we all know, Pipali, Dhyamaga, Jadamamsi, Kushta, Yeshtimadu. And there are also other ingredients such as Ela, AACHAARA, Kudannada, Nada, Kushta, Ishtimadu, Chandana. So it describes the clinical experience of Dr. Vignesh sir regarding Dushi Vishari Gulika. It relieves basically accumulated. Dushi Vishari is known as the basically accumulated toxicity in the body. It may be as external poisons as well as toxins that enter inside us due to exposure to various chemicals. The urban lifestyle of 21st century were eating outside, exposure to chemicals, be it from cosmetics, air pollution, or formaldehyde in a new clothing, has led to medical conditions that are difficult to diagnose and treat. And the explanation of Dushi Visha, which is buildup of toxic metabolites resulting from Amavastha in the body, manifesting as low metabolism, allergies, liver issues, hormonal discrepancies such as diabetes, hypothyroidism, skin disease, and sensitive gut has become very common among many patients today. And Dushi Vishari Gulika is one of the most underrated and underutilized Aushadha for our current times, where exposure to toxins and chemicals have become inevitable. So the medicine is mostly administered during the initial stage of Amapachana and Dosha Shodhana, and highly beneficial in such metabolic dysfunctions. So next is Shigru Punarnavadi. Shigru Punarnava Manjal Vayambum, Chandana Padhyod Ishwaramuli, Eshti Girisha Nerinilumopam, Tekilodan Vishavikam. So it is mainly embroidered Vishavikam, that is swelling, proton bites and stings. So some Ludha, etc. Some organisms will be bited, the inflammation or the edema which is came from that bite, Vishavikam. So main ingredients, Shigru, Punarnava, Haridra, Vaja, Shirisha. Other we know, we have Chandana, Padha, Ishwari Mula, Ishtimadu, Shirisha, and Gokshura. So it is used as external paste in different Visha conditions, especially on swelling brought by bites and stings, mixing with suitable liquid medium according to the conditions. So this is the clinical experience of Dr. Ramanathan sir regarding Shigru Punarnavadi Churna. Shigru Punarnavadi Churna is a potent Churna combination with its reference in, it is taken from our classical text Prayoga Samuchayam, an ancient text in Keraliya Vishwachikitsa. It is generally used externally as a leva, that is as a paste, and very rarely internally when deemed fit by the physician. It is extensively used to treat inflammatory swellings that are kapha pitta predominant. It has quick action on itching and edema brought on by bites and stings. In general practice, it is very effective as poultice in deep tissue swelling and resultant joint dysfunction. Its Tikshna Ushna properties permeate easily into joint space and other fascia to relieve inflammatory swelling and pain. The presence of Punarnava ensures that the repair and regeneration of skin and deeper tissues occurs parallel to the healing process. So, as I said previously, to receive the notes of Yoga Amrit in your WhatsApp, the mention, you can send a text to the mention number. Visit our website www.sitaramayurveda.com. If you could not find a mail in your inbox, please check your spam folder, promotions folder, social folder, and career folder. So to please save our email ID into your contact, support at sitaramayurveda.com. We are sending also e-certificates to all the participants who attend this webinar for more than 75 minutes. We are sending the notes and recordings to the email ID, which the registrants use for registration by subsequent Saturday. So next is, please send your name, location to the following number of Sitaram to get all the updates, links and notes of Achara Rasayanam. So for any support from Sitaram Ayurveda, please can contact our customer relationship manager, Mr. Rajiv, in the below mentioned number. And his email ID has also been mentioned, crm.osk@sitaramayurveda.biz. Thank you. Thank you. My presentation is over.
Thank you, Dr. Aditya. So we are now moving on to the Q&A session. Dr. Arun?
Yes, doctor. Should I read the questions?
Yes, yes. Can we move on to the session?
Sure. So I'll start from the first one. Just one
So
second.
the first question is from Dr. Ashwini, and she is asking how to assess Pitta in Stanya Pariksha.
Doctor, it is actually majority of our cases that I have documented is not of Pitta Pradhanam, but technically Pidaraji is one of the important feature which can be utilized in assessing Pitta dosham in Stanya Pariksha. You can see yellow strains or yellow strands in doing Stanya Pariksha, then this Guru Sabhavam or the sudden sinking of the Stanyam or Tandumutsa Bhavam, etc. are not seen in Pitta Sabhavam. But technically speaking, Pitta Pradhana Stanyam doesn't come to our OPD in a huge number because we don't see these type of Pitta Dushti in clinical practice when compared to respiratory issues. But of course, if coming to the skin lesions and all, if you do Stanya Pariksha, you can see this type of Pidaraji. So Pidaraji should be considered along with the clinical presentations of the child, along with the Nidanas taken by the mother. These should be clubbed together and should reach a final conclusion regarding the Paitika Sandushti. Okay.
Yes. So another question is from Dr. Irfana. She is asking specifically about the use of Jatyadi Kritam in Gudaguttagam.
Actually, Jatyadi Kritam is a Vrana-Ropana Aushadam. And as I told you, in any cases, the external application cannot be made all of a sudden on seeing a skin lesion. If you feel that the Sneha Prayogam may aggravate the condition, means you should not use any type of applications there. But there are some other snehas. For example, I'll tell you, there are some snehas which are modified by undergoing some samskaras to make it more pajanam in nature. This is the reason why we apply Murivanna in a Bhaknam, or we apply Niridhaladikeram in an acute stage of Amavastha, because they have been modified in such a way that they have that property to address the Amavastha with the respective medicines or respective combinations. Other than such type of medicines, none of the external applications should be made in the acute stage. Jatyadi can be used as a Vrana-Ropana, means it is having a mild inclination towards a Pajana property. So the Vrana-Ropana can be made with Jatyadi, but still we have to keep in mind the child is continuously getting exposed to same Nidanam. Whatever you tell, sometimes they will be having the recurrence of usage of diapers for long duration. The child's skin will be exposed to the malam or the mutram. So in such conditions, if we give an oil, means it again may chance of blocking the skin pores is more. So apply this common understanding of the modern perspective as well as the Amavastha. Have a liberty to choose your medicine based upon the child's condition. So I feel that in the first or 2 days, preferably avoid Jatyadi. And once it starts healing, means Jatyadi will be a good choice.
And Dr. Savitri is asking the calculation of the dosage of medicine based on age and weight in children.
I was expecting this question. All classes will be expecting such questions from the audience. But unfortunately, the challenge is that we cannot make a dosage purely based upon some basal metabolic rate or the anthropometric measurements. That is the challenge, as well as I believe that is the beauty. Because our science is purely a functional one, isn't it? We believe, we discuss, we promote the idea of functional entities. We discuss about tridoshas. How can you measure tridoshas inside the body? Means it is not an anatomical entity to be measured. It is a functional entity based upon the functions. So practically, we are dealing with functional entities So the dosage cannot be, I feel so, because if a twin child comes to your OPD means, you cannot give the same dosage to both twin children, even though they are presenting with the same clinical presentations. Because we have to look about the Prakriti, we have to look about the Agni Swabhavam, we look about the diet pattern that they are following and all, isn't it? So generally, the dose cannot be made with the help of purely age or weight. But in general, the dose change is based upon the formulations as well. Even in Kashayam, for example, in the case of bottled Kashayam, the dose will be different when compared to a prepared Kashayam, even though both of them are Kashayams. But generally, what I would like to say is, in the initial phases, say if the child is during a period of 1 or 2 years of age, if you are trying to give one Kashayam, means around say 7.5 to 10 ml will be a good choice. This is just a rough idea, because if I get a question, I should answer it in a sensible manner, isn't it? So this is just a rough idea I'm conveying. If the child is between 1 to 2 years of age, you can give around 7 to 10 ml of Kashayam if that is not that much potent. For example, you can give Guluchari Kashayam or Drakshadi in this particular dosage. At the same time, you may not be able to give Aranati Kashayam or Gugulu Panchabalam, Churnam or other potent drugs with the same dosage. So this has to be kept in mind, because the age is not an exclusive criteria. I'm really sorry to say that I cannot give a clear picture regarding the dosage, because that depends upon the patient's other features as well.
You have stated in your presentation about the use of Haridra in Adhiroma. You stated it as an Asadhya Roga. So now one question from Dr. Nilakshi is regarding the usage of Haridra. Is it treated by this drug? She is asking whether we are attempting to treat Adhiroma by using Haridra.
Actually, in mild cases of or Sthanika Vriddhi of Romam, Haridra may be helpful. But I don't think that the Asadhya term Adhiroma is not a Sthanika Vriddhi of Romam. The Kashyapa has mentioned Adhiroma as an Asadhya Rogam, not because of a Sthanika Vriddhi of Romam, but due to the Sarvadehika Vriddhi of Romam. I don't feel that in such cases, usage of the single drugs or usage of other combinations will help us in addressing such conditions. But of course, in local conditions or the Sthanika Vriddhi of Roma, because there is a belief, or in clinical experience also we used to hear, that is the application of Haridra is not recommended in male children in the younger age. This is because of the fact that Haridra is having Tiktarasa, it is Shoshana, it is Sukshma in nature, it is Laghu in nature. So these things may end up in decreased hair growth. That may be the reason, the connection of Haridra as well as the Romam. But technically in Adhiroma, if it is Sarvadehika, Haridra will not be a good choice in addressing such conditions.
What about the fungal infections in small children, especially when it is spreading from parents? The question is from Dr. Sandeep Chauhan.
It is basically an Upasargika Rogam. So the Krimichikilsa should be adopted there. The chance of the increased fungal growth, especially when the rainy season starts, the itching over the waist due to the improperly dried clothes may be seen, the itching in the padam area, like that of alasagam, can be seen because of the wearing of the wet this socks and all. So avoiding the identifiable cause, making the area dry, going for Krimichikilsa, and external application with the contents which is having more gandhagam will be helping a lot in addressing fungal infections. If you are not getting sufficient external this patent drugs or and all, I generally recommend just the application of Haridra paste itself in addressing fungal infections. And tinea is very common. Tinea growing is very common in young children. In the teenage group, it is very common. So without having a proper detailing of the possible nidanas, it will recur or will not subside. So what they blame is they have used Ayurvedic medicines and it didn't subside. So give a clear-cut idea regarding the nidana perspective as well in addressing fungal infections in children, not only in children, but also in any cases that comes to you.
And there is a very usual problem which we face in administering Kashaya for children. So Dr. Pradeep Chaudhary is asking how to deal with the taste of Kashaya, how to make it more palatable for kids.
Actually, Dr. Pradeep, I have mentioned the significance of usage of rasam in my initial slides of presentation. So, but yes, I can understand the feeling because as clinicians, we all face such difficulties because the patient will tell us that the child is not taking kashayam, we are moving to modern medicine, isn't it? We'll be facing such issues in our day-to-day practices. But I think that compromising the principles will not do any good to the future practice of our science. If we give kashayam with a drug which is just selected based upon the palatability, means it will not do any good to your practice, or it will not do any good to the addressing the clinical conditions sitting in front of you. Instead, it may aggravate the condition as well. So initially, have a detailed discussion with the parent, convince the parent regarding the significance or the importance of using the medicine as such is much, much, much important. Then the next step is, if this is not working, what I generally do is I'll be going for kashayam tablets. So kashayam tablets is a good choice. Nowadays, most of the companies are preparing kashayam tablets. That can be sought as a next choice if this is not working. Thirdly, you can go for arkams. Many of the kashayams are transferred into arkams, even though kashayam and arkam are two separate formulations, even though we can't expect the same result as that of a kashayam, but still you can try arkam, especially tiktarasam and all. I have seen good results by using tiktagam arkam, panchatiktagam arkam and all. And in Krimi Chikitsa and all, we used to prepare Vidanga Krishna, the Kashaya Arkam. That works well. Almost equally competent to that of a Kashayam. So that can be tried. And Kashayam sachets are available nowadays. Kashayam sachets can be tried. So these are the methods which I adopt because I don't believe that you will be losing a patient if you compromise in the palatability, or if you work more on the palatability, you will be gain more patients. I don't believe in that concept because the patients which I see day to day, when we discuss with them properly, if that is a genuine patient who is coming to you to address a genuine health issue of the child, means they'll be ready to make the child accommodate with the respective rasas. Slight modifications, of course, we can make. So sometimes I'll be compromising in the Aushadha Kalam. As a clinician, I should not tell this, but sometimes I'll be compromising in the Aushadha Kalam. For example, in case of a respiratory issue and all, I'll be combining the Kashayam and Arishtam, and I'll be giving it after food. But in some cases, if kashayam is the only choice, especially in case of skin lesions and all, I will not be able to give the kashayam as that of a whole kashayam, which is a laghu kalpana before food. Sometimes I'll be giving the kashayam as divided dosages in small quantity, frequently say after 1 or 2 hours, I'll be dividing the dosage and be giving. That all those things depends upon the patient sitting in front of you and the way you communicate to the patient. I believe in that.
Thank you. So one another question is regarding the Makkipuvadi Kashayam. Its reference.
The reference of Makkipuvadi Kashayam is Vaidya Tarakam. I told you Vaidya Tarakam is a Malayalam traditional Balachikitsa Grantham. The two important textbooks are Arogya Kalpadruma as well as Vaidya Tarakam. In Vaidya Tarakam, you will get the reference of Makkipuvadi Kashayam.
Dr. J.V. Solanki is asking regarding the standard protocol for regular deworming of a child.
Very interesting question. Usually, even the Ayurveda doctors feels that every 6 months is the time gap that is required for performing a deworming treatment. Because we believe that as long as a child is not presenting to us with perianal itching, we feel that the time is not yet reached to the child to give a deworming medicine. But interestingly, when we look into the classics, we can see the Guda Kandu is just a lakshanam of Purishja Krimi. So to give a deworming, if you are depending an exclusive, a single lakshanam of a Purishja Krimi, means we are out of the principle, isn't it? So what I genuinely believe is that if you feel an amavastha, if you feel ajirna swabhavam, if you feel a decreased appetite, if you feel a slight white patch, if you feel a perianal itching, the whole concept of krimi should be kept in mind and modify the krimi chikitsa accordingly. Because we know the child is continuously getting exposed to all sort of kabhamedo vardaka aharas, which has been clearly mentioned as dhanam of Shleshmaja Krimi as well as the Purishja Krimi. Especially when I discussed about the Pathyam, I clearly told that the Masha Samskrita Aharas, which is more Guru, Snigdham, and Ushnam, are considered to be as the contributing, a major portion of the contributing element towards the Purishjanya Krimi. The shaga vargas, the leafy vegetables, are considered to be as a contributing element towards the krimi. So we give all these things on regular basis. Means we are giving regularly some entities which are believed to be as the nidanam of Purishjanya Krimi. Means the chance of a disease to happen inside the body is more. It is very clear. So select a protocol depending upon the child sitting in front of you. Sometimes the child will be perfectly all right, means 6 months may be enough for the particular child. Otherwise, the child is having recurrent respiratory issues. Many a times we'll be seeing recurrent respiratory issues addressed by just by Krimi Chikitsa. We'll be getting respiratory issues, sneezing and all. We'll be giving Nirgundyadi Kashayam, Kramikna Guliga, and we'll be addressing respiratory issues. That is just because of the fact that this respiratory issue is due to an decreased or an immune due to the immunocompromised state that has happened due to the Krimi. So the Krimi Chikitsa should be designed in such a way based purely subjectively, and it should not extend beyond 6 months. That is my take on this. And the Krimi Chikitsa again should be modified based upon the demand of the child. You cannot select a universal drug acid of albendazole for performing Krimi Chikitsa. Sometimes you have to adopt the Krimikna Guliga, Krimishodhini Guliga. As I told you, Ariyaradi Guliga is a Bisarpahara as well as Krimihara Guliga. Gopichandanadi Guliga again works the dimension of Krimiharatvam. Vedanga Kashayam, so many medicines, n number of combinations from the patent drugs also available in the market. So you make a choice of your own. The intention is making the child not arogi but swastha. That is more important in doing Krimi Chikitsa, because the Nidanam is continuously happening and sometimes child will not presenting with any clinical features, but still now the situation is standing in between. Nidanam is happening, no clinical features. That doesn't mean the child is swastha. That just means the child is without lakshanas or child is arogi. So our intention is to move the child from aroga avastha to swastha avastha, means this should be given regularly, and this regularity purely depends upon the subjectivity.
In connection to this, Dr. Sutish is asking whether deworming every 6 months will badly affect the intestinal microbiome.
Very interesting question. Excellent question, doctor. I appreciate that. When you go to PubMed and all, you can see there are so many references relating the connection between the continuous usage of albendazole and APD. APD is acid peptic disease. That is the concept of giving Krimi Chikitsa in modern medicine as well as in Ayurveda Chikitsa are different. That is why we discuss about specific nidanas. We discuss about the type of Krimi. We approach differently in different Krimis and all. But the mebendazole and albendazole are the two common choices that was given by the modern perspective, isn't it? Just think about the Krimi. Leave all the things. Just think about the Krimi that causes perianal itching. When we go to the life cycle of those Krimis, we can see around 21 days is the life cycle of those Krimis. That is, the Krimi lays the eggs. The adult eggs moves to the cecum or rectum, gets matured into adult worms. It moves towards the perianal area. It lays the eggs there, which remains viable for more than 20-21 days. The laying method of this worms is creating itching in the child. So what happens if we give one single dose of albendazole or mebendazole? It just flushes out the internal coating of the intestine literally, isn't it? But still, the viability of the eggs that was laid by the adult worm is still remaining in the perianal area. We know the mode of transmission is fecal-oral route. If by any chance the child's hand get exposed to the perianal area or the undergarments of the child when touched by the parent, all these things are precipitating factors for an initiation of fecal-oral route. Then what happens? Again, the egg enters inside the body. So again, the child becomes with clinical presentations. So a sensible method of Krimi Chikitsa is very much essential rather than applying this albendazole, mebendazole regularly to prevent the chance of such type of amlapitta swabhava vikaras, or sometimes it may end up in losing the normal gastrointestinal flora, isn't it? So technically, try a method based upon the creamy presentation of a child. If the child is having perianal itching, sometimes the internal medicines itself may not be enough. You might have to think about an Avagaha Svedam. Sometimes I have treated patients with creamy. The parent came and told me that the child is having creamy while defecation, along with the fecal matter, bulk quantity of worm is coming out. In such cases, other than the administration of Krimihara Kashayas, I have given Matravasti with the thailas like that of Nimbamradadi Eranda Thailam. Interestingly, the therapist told me that after the administration of Thailam, he could see the bulk of worms coming out of the intestine. There a Pachana Sneham was used, which is more Krimiharam too. That was Nimbamrada Erandam. But on the other hand, if a white patch of the skin comes to a OPD, I still adopt the principle of Krimi Chikilsa. But there is no intention of doing a Matravasti Nimbamrada Erandam. I'll be giving a routine Krimihara Chikilsa. A drug will be selected, which is Krimihara. At the same time, it should have an affinity to perform Rakta Shuddhi too. Such type of modifications should be made at least by the Ayurvedic people, what I feel as a method to improve the bala of the child. The Yuktikrita bala should be addressed in such a manner. I think so.
Okay. Now, Dr. Jayakrishan is asking a very important question regarding the talam, which is very specifically mentioned in the treatment of skin lesions in Kerala Biologicalsa. So he's asking about Dr. Arun's experience in using talam in skin diseases.
Actually, I have not tried much medicines with respect to the application of talams, because in skin lesions, we don't get an opportunity to admit the child and do all these procedures and all. We'll be going for OP procedures. So technically, the simple medicines I have not tried in such a way that they can be advised at home. But on the other hand, in case of respiratory issues, in other issues and all, we have tried the talam. But in skin lesions, I don't have an upper hand or a better experience to be shared. I think Dr. Rahul will be having better experience than me in talam and all, or Dr. Emya will be sharing better experiences. I don't have a good experience in talam in skin lesions.
I think we are also having the same issue in other conditions like myofasciitis, the common joint-related issues. We are using talam, but in case of skin issues, I am not handling so much skin issues. So I think I have used Kachuradi Churnam, Rasnadi Churnam, Nimbamradadi Erandam, Kartavata, etc. Or even in Jambira Swarasam or Panikur Kaila Swarasam, etc. But that are all related to the other issues, not specifically related to dermatology. And another question is also from Dr. Jayakrishan. It's a very broad question. The question is regarding the classification of skin lesions according to dosha predominance, as that we see in Ashtanga Hriday. So, Dr. Jayakrishan is asking, can you give brief outline of treatment principles that has to be adopted according to the dosha predominance?
Very interesting question. Actually, in the first slides I have mentioned, while discussing about the basics of a bala, I have told that the bala is asampurna dhatu. The one that is incompletely formed will always be confused with the absence or pathology, isn't it? So it is very difficult for us to differentiate a pathology and physiology in general in pediatric practice. This is the reason why we have some conditions known as physiological variants. Physiological variants means that may not be seen in all patients, but still that is not a normalcy. They are known as physiological variants. For example, birthmarks that may not be seen in all patients. Birthmarks may be confused as a skin lesion. On course of time, sometimes these birthmarks may lead to some other skin lesions. Such type of confusions and complications are still there, not only with respect to skin lesions, but with respect to all issues in children. But basically, from the respective Rogi Parikshas or from the data which we get from a clinical experience, generally, I believe that the minimal medicines principle, which I have mentioned in the initial slides regarding the medicines and all, I have given a rough idea regarding the dosha haratva swabhava of the respective medicines. That can be tried purely based upon the principle which we adopt in addressing adult lesions as well. Because that is the reason why Acharya has mentioned that Taeva dosha, dushya, jvaradhya, vyadhesheda. The same dosha, dushya, and disease are happening in the adults as well as in children. The only difference is that Sukumara, Akleshasaha, Asampurna Dhadu, all these things should be kept in mind. So these extra points that should be kept in mind was told by me as the difference in pathology and physiology, as the difference in physiological variants. So otherwise, everything remains same as that of the adult only. And the important part is Kaniyasi Matra. The dosage should be controlled based upon the quality as well as the quantity of medicine. That is a difference which we should keep in our mind in addressing any type of lesions, not pure skin lesions. Hope that was clear. That was the question to be answered, isn't it?
Yes. And, one important question from Dr. Senthil Kumar. You have mentioned about the plantar psoriasis. So he's asking, how can we differentiate the plantar psoriasis and eczema of foot? And how, from an Ayurvedic viewpoint, the line of treatment is differing?
Actually, eczema is a common term which we give for any type of inflammatory lesions in the child. Eczema very commonly we use for atopic dermatitis. That is another point. But generally, eczema is any type of inflammation. Psoriasis is yet another different domain, isn't it? The uncontrolled multiplication is the presentation of a psoriasis. Even though both of them is having an autoimmune perspective, even though both of them is having a genetical predisposing element, both of them are clinically entirely different conditions. I think that if you go through the details of psoriasis and eczema, it is made clear. The approach also is different. For example, in case of a plantar psoriasis or a type of psoriasis, the snehapana-like procedures will be much effective. At the same time, in case of an eczema, there is a challenge in giving snehapanam and all, because usually eczema is noticed in very small children, and the age itself is a difficult time to administer sneha prayogas. In the case of psoriasis, the aggravation or the factors can be compared with that of the eczema, but the presentation itself is a different pattern. The presentation cannot be compared at all. It is a different area. I think that the method of treatment again purely depends upon the difference in presentation based upon the dosha that is traced from the clinical presentations. So I don't think it is a comparable entity, this psoriasis as well as eczema. Both of them are two different things, and the management of psoriasis as well as management of eczema are two clear presentations which was made in this presentation itself. Eczema is a challenging condition. The concept of visha has to be kept in mind addressing this eczema. This concept of continuous anulomana swabhavam should be given. The yapya swabhavam or the asadhya swabhavam of eczema should be kept in mind. Whereas coming to psoriasis, it is a pure autoimmune condition. As the age advances, there is a chance of modifying the condition. All these things has to be kept in mind. Otherwise, I feel that the difference is there. The big difference is there. It is not at all comparable.
Yes, doctor. Regarding the morphology, I think in psoriasis you will get well differentiated, well demarcated plaques with the scaly.
Yes, scaly lesions.
Whereas in eczema, that will not be so much well demarcated. Mostly a maculopapular lesion can be seen.
Yes.
So
and eczema usually spares the flexural aspects as well.
Yes, yeah.
Eczema usually spares the flexural aspects.
Yes.
When compared to psoriasis.
And as the time is running short, I may conclude into some important questions, and some questions are already we have talked in the session as well as repeated in the doubt clearance session also. And one important question coming from Dr. M. Harika, she is asking about the treatment of scabies.
Very important. Scabies is a condition, it is an upasargika rogam which causes severe itching. Here the bahya krimi is causing the specific condition. So in such cases, what I recommend is that the modern people, they be using some chemicals to remove this particular organism from the skin. So generally what I advise is, I'll be advising Bilwadi Gulika with the tulasi swarasam in this special itching area, and this organism should be removed. So that is the first line which I adopt along with krimi chikitsa internally. After that, once the itching subsides, then we can adopt the principles of Visarpa chikitsa. Exposure to Nidanam should be checked for very importantly. Usage of same cushions, same dresses, sitting in the classes where the chance of an infection is more, all these things should be addressed.
One doctor is asking regarding to which modern disease entity to which we can equate Karapan. Can you hear me?
Yes, it's clear.
Yes.
To which entity the Karapan should be compared of, isn't it? That was the question.
Yeah.
Fine. Actually, when we go to the details of Karapan, I have mentioned in the context of Prakaranas, into which we should look into while addressing a skin lesion, it was told there. Karapan is the technical term that was used by the traditional Bala Chikitsakas to mention any type of skin lesions. Karapan means karandu in another, that is spreading. The spreading nature of a disease has been told as Karapan. So I technically believe that any type of skin lesions can be given the usage of Karapan, but based upon the specific term Karapan, Visarpam will be a Bala Visarpam is the comparable entity. Because when we compare the Bala Visarpam to cellulitis means that will not be the exclusive entity of Karapan. So it differs. The basic morphological presentations has been classified under 51 headings. That is what is known as Karapan Arogya Raksha Kalpadramam. For example, if you see a skin lesion which resembles a masha means that is known as Ulunumani Karapan. If you see a skin lesion with the resemblance of Mudgam means it is known as Cherubayramani Karapan. Such if it is a resemblance with a fast spreading means it is known as Agni Karapan. So the Karapan cannot be 100% compared with the modern diagnostic perspective, but based upon the term Karapan means it is a spreading nature, not because of its Upasargika Swabhavam, but because of the fast spreading nature that the term Karapan was given.